Sinovac supply vaccines to eliminate human diseases. Human civilization travels through the plague. In this long human history, human beings often fail when facing infectious diseases until the emergence of vaccination. In the last 200 years, vaccination has played an irreplaceable role in reducing mortality and increasing the average life expectancy. The development of each new vaccine represents a great victory for humans in the fighting against infectious diseases. Sinovac has never stopped to provide the vaccines to eliminate such diseases. While time advances, the challenge that human health is facing more and more complicated. When many diseases have not been completely defeated for many years, no matter it's SARS, avian influenza, hand-foot-mouth disease, or H1N1 influenza and COVID-19, the sudden appearance of these newly emerged diseases has sounded the alarm to human society again and again. While humans are fighting against diseases, they also witness the miracle when vaccines saves life. Every time, when facing uncertainty of a new disease outbreak and under great pressure, Sinovac always stepped forward and quickly joined the front line of epidemic prevention to contribute to the national as well as global disease prevention and control is the responsibility that Sinovac takes. Every single dose of vaccine carries the great expectations for an individual, a family, or even the entire society. In the laboratory, Sinovac's research and development team is rigorously and orderly carrying out the vaccine development every day to search for effective solutions to prevent and control infectious diseases. In the production plant, the production process complies to international standard and quality control system that covers the entire life cycle of a vaccine, guarantees for every dose of vaccine from Sinovac, which deserves the trust of life. In the community, when Sinovac's vaccine is timely delivered and safely provided to people, it will provide effective protection. Through the research, development, production, and application of high-quality vaccine, Sinovac's vaccine is bringing a healthy life to people and ensuring harmonized development of the society. Today, Sinovac's vaccines are providing effective protection against infectious diseases around the globe. But looking into the future, Sinovac will make its best efforts to ensure the accessibility and affordability of human vaccines worldwide. Sinovac aims to provide more and more high-quality products. Sinovac allows more and more people to benefit from using vaccines. Sinovac supply vaccines to eliminate human diseases. Human civilization travels through the plague. In this long human history, human beings often fail when facing infectious diseases until the emergence of vaccination. In the last 200 years, vaccination has played an irreplaceable role in reducing mortality and increasing the average life expectancy. The development of each new vaccine represents a great victory for humans in the fighting against infectious diseases. Sinovac has never stopped to provide the vaccines to eliminate such diseases. While time advances, the challenge that human health is facing more and more complicated. When many diseases have not been completely defeated for many years, no matter it's SARS, avian influenza, hand-foot-mouth disease, or H1N1 influenza and COVID-19, the sudden appearance of these newly emerged diseases has sounded the alarm to human society again and again. While humans are fighting against diseases, they also witness the miracle when vaccines saves life. Every time, when facing uncertainty of a new disease outbreak and under great pressure, Sinovac always stepped forward and quickly joined the front line of epidemic prevention to contribute to the national as well as global disease prevention and control is the responsibility that Sinovac takes. Every single dose of vaccine carries the great expectations for an individual, a family, or even the entire society. In the laboratory, Sinovac's research and
你说这个摄像头不用的是吗？来，先放视频。没关。喂。喂。喂。对，我现在听不到我说话，你得把那个。对。对，现在不放片，放片了，把它关了。放片的时候打开啊。忘了。就放视频。啊，不是。对，刚刚调成27度，直接有画面了。这是延迟，延了挺久。延迟肯定会出错。现在画的是啥样的？正和那。对。 对，这是那我共享一下。现在我共享了，你这里便利调一下。你刚才他说而且为啥不共享？我在想这个就能打共享。
我忘了点在哪儿了。
那一个是是吧？对，有一个身体条另外
等一下啊，我给你一个，你举一下手来。这个身份那边。
这个画面又有那个飞飘了。
我现在我在调。
这个无所谓，因为咱们直播里面没有。
这必须进入标准。
然后
都是人家。
现在 YouTube 是什么画面？YouTube 画面。
YouTube 是这个画面。
那现在
还延迟着呢，但是也还是有那个效果。都可以扩。
现在50号。
我现在上
喂。
可以。
喂。
你进去是观众。
可以听到。
你说话。
来，
可以听到。喂，能听到我说话吗？
但是这个直播的画面为什么不是3分屏的呢？不是。直播的画面不是那个3分屏。你想？
你这3分屏公交了。它不是公交的方面。是。
不是。知道吗？ 对，这边那个一会儿一会儿
我们现在也是举了个手，分配一下加工的。
他那个举手的那个
举手了。
是要干嘛？介绍。用你的电脑先，用你的电脑，不用电脑啊。哦，哦，可以。你的名字叫啥？哦，把它设成那个，把它设置成那个联谊主持人就行了。他到时候要开摄像头的。就对，有的人员。
喂，
人员。这个。他是联谊主持人。你得账号登录了。
弄。交币啊，只弄。
哦，他是联谊，把它设置成联谊主持人。弄完了。更多。
弄完了。谁的？
不是
他是吧？
更多。哦，对，更多。
是他。
设置成联谊主持人。哦，对。是。对，现在可以了。它可以共享视频了。
就是你们研究出来没？那个就是客户直接进那个一个的。
他们也是直接模式，其实就是跟
他得要那个链接，你说他那个链接怎么得到的？他就没有这么操作麻烦，人家讲者直接进那个链接进来就是讲者。
但是因为他那个链接只是后面加了一个后缀，所以加
有刘总。
不会觉得。
是个女的，还说你说不是这个，是个女的，啥？稍微让我下别慌，太好让他妈照片和拍头，换一个女士，那是个女的，他说的也是个男的，而且甚至也感觉就是他们跟他们也是过的，他们也没感觉。加油，赶紧冲去！
哎，如果我要是换一台是健康
对，他得给你设置成主持人了。
锁定那个后台不行，是不是已经锁定了？已经锁定了。
你说不没有了，我们这边要推死了。
那个还能看吗？
说还能看后边后天上。你把链接给我，我在手机上可以。是那个你后来发给我，对，就那个 A 打头的，没事，我直接手机上，我自己查。
然后就是
这个
好的，我打了一下。
我看到了，上面都是2.2码。有微言没有太多，有啥？哦，还有什么？行，我改。我编了。
在求职。这个，哎呀妈呀！是太早。
不知道。该动了吗？不是拖来的。拖来的。啊，是。你接着录像没？
没有。
哎
呀，什么现在能控制？能够。还是发大公式。对。 doctor 总是不会错。好，把这个名是按照这个名字。不是我们的。对，提升价值，提升整个这个提升价值。高效事情。还有时间。就是把什么这块给人翻译。就放什么你翻译现在没有方面。有道理。
现在是有延迟。
那个初步延迟比较少。公布公共卫生项目和举措办公室。日常部。公共卫生项目办公室。卫生人口助理部长。技术干事。然后部长。卫生部长。
下面有了吗？
不。还有卫生卫生人口部部长助理。公共卫生项目办公室。这个办公室应该就是他专门那个方向，那就是这么说。埃及对呀，这个部长。可以。
又没了是吗？等会儿。出的啥呀？嗯？又没了。
就需要是那种特别奇怪。
为什么我们看不了呢？是有 VPN 是吗？
对，我是连了 VPN 的。
对，我把那个我共享一下东西。
特别奇怪。
为什么我们看不了？做一下什么？共享一下。哎，现在有人共享。是有人共享的没？一切都三分钟。看不见了。哎呦，这是共享这种。
Human civilization travels through the plague. In this long human history, human beings often fail when facing infectious diseases until the emergence of vaccination. In the last 200 years, vaccination has played an irreplaceable role in reducing mortality and increasing the average life expectancy. The development of each new vaccine represents a great victory for humans in the fighting against infectious diseases. Sinovac has never stopped to provide the vaccines to eliminate such diseases. Well-timed advances, the challenge that human health is facing more and more complicated. When many diseases have not been completely defeated for many years. No matter it's SARS, avian influenza, hand-foot-mouth disease, or H1N1 influenza and COVID-19, the sudden appearance of these newly emerged diseases has sounded the alarm to human society again and again. While humans are fighting against diseases, we also witness the miracle when vaccines saves life. Every time, when facing uncertainty of a new disease outbreak and under great pressure, Sinovac always stepped forward and quickly joined the front line of epidemic prevention to contribute to the national as well as global disease prevention and control is the responsibility that Sinovac takes. Every single dose of vaccine carries the great expectations for an individual, a family, or even the entire society. In the laboratory, Sinovac's research and development team is rigorously and orderly carrying out the vaccine development every day to search for effective solutions to prevent and control infectious diseases. In the production plant, the production process complies to international standard and quality control system that covers the entire life cycle of a vaccine, guarantees for every dose of vaccine from Sinovac, which deserves the trust of life. In the community, when Sinovac's vaccine is timely delivered and safely provided to people, it will provide effective protection.
给它放这儿就行了。
还没开，视频、音频都开上。
开，观众在这里。
看一下那个观众界面是啥样？
观众界面是这样的。
那个 YouTube 那个
主持人，你为什么这样
YouTube 呢？
？YouTube 放一下，放。
我还没到，没到。
哎，翻译
没有，大概5分钟之前。为啥没有视频呢？你的视频吗？
哎，它为什么没有出现在那个就是屏幕上呀？我有点懵。
是这样是吗？但是这屏幕并没有我。
哦，我
因为这个屏幕是共享的，共享的上家。你给他设置一个那个视频。
我们是在上面有两个。往这改完以后。哎，我现在可以看到一个屏幕啊，是你是陈帅啊，模糊的脸，你看在这里很小，我把它横屏了，我来看一眼。
哎，我的这个是主要是他的电脑。那是不是应该他来提供一下这个？
啊，我还可以隔空，靠隔空。
不是妍妍，妍妍，我现在是袁总，我要做 opening room， 就是 opening。
随便说点什么？
那我必须得让观众看到我现在这个头就应该是我的头。对啊，这个人
我这边看到是。
但是这上就没有。他开摄像头了，那就是我的结束停止共享，对吧？我的停止共享了，然后就都是他的。
看见了，是这样吗？
对啊，
那看不到他的 PPT 了。
但是这个界面不应该是咱们一开始想的那种吗？中间是他视频的那个界面。
现在可以
啊，对。
你看现在是延迟，他才听到。
对。
这是行了是吧？
我现在就开始做 opening 了，然后就说一堆什么我们欢迎我们的 speaker today， 尹总，然后巴拉巴拉那个 minister， 然后还有 Monica， 还有 Albadri， 然后那个视频什么的都准备好了，是吧？行，然后我就欢迎尹总，这回我的结束了。
他假设那个袁总说完了。
等一下啊。
然后谁切的这个尹总的图片？是你切的吗？
对，是我切 PPT。刚刚不是想的是他们讲话的时候照片在中间吗？我看你那个直播界面没有 PPT。
没有，我这边这个是有的。你等一下，我刚才把它停住了，得等缓一缓你才能看得到。你等一下。
就我有点乱，就是我现在是，比如说哈。音打开视频，打开。讲话了啊！大家好，欢迎我们今天的speaker 第一位是尹总，第二位是阿尔及利亚工业制药部部长，第三位是乌干达科技部部长，第四位是埃及驻华大使Albadri 先生。好，现在有请尹总致辞。
或者是放
这个
在
就是介绍他的时候出现一下，等他讲的时候就是他的视频切大放在中间嘛。咱刚刚不是说的？
就是放这个吗？刚才那个本人介绍。
本人介绍是袁总介绍一个。
对啊，就是到他这个他肯定
对，先介绍完了，然后尹总上线的时候就只是视频，只是尹总的视频。
整个画面就是他一个视频。
对对。
然后切吧，现在就开始了。
对。
行吧，那就现在
然后下一个是视频播放的，也是切为大。
这个就相当于现在尹总开始制作，然后这个东西呢，怎么给它别？
这边是在考虑到出行，出行是什么意思？
就是会上线，是爱奇艺。
小脸的关，在群里看看。我没太懂他什么意思，他说他就是，因为他飞萌是在北京的，我怕
没有来吗？
你得问香港，所以我问香港。
在合影面时，他是上线。
袁经理介绍的时候还是 PPT 加的这样是吧？
就是咱们那主界面，就是欢迎那个，就是最开始那一张界面，然后就是他的头在那里说。
他的左下角是他的。
他没有，他就是稿。然后这个咱们试一下吗？还？我现在说就行吗？这个现在可以吗？现在可以。行。Zoom听得见吗？
听得见，我两边都听得见。
行，然后我就做一个致辞，说了大概说行，我这个部分就到这儿。欢迎，最后一句话是什么？再次感谢各国嘉宾的出席，期待大会圆满成功。谢谢大家。我说到。
我记一下。
现在几点了
？15:47。
这块完了吗？
就是我是第2位了，尹总。然后我到最后会说，再次感谢各位嘉宾出席，期待圆满成功，谢谢大家。我这 part 就完了，就把这个摄像头关掉就行了。
袁总他就会介绍下一位嘉宾。然后这个的时候就是 PPT 是在中间的，左边是就是袁总和，然后我又这块不用整了，就是他介绍下一个人的时候是这样的，然后他介绍完之后，我们就把这个停止共享，然后中间就又变成这第2个人不是播放视频的嘛，中间就播放第2个人的视频。
第二个人这就是当时也是发现。
对，第2个，然后第4个人是视频。第2个是谁啊？第2个是阿尔及利亚的一个
工业制造部的部长。
那个袁经理的介绍第2个地方不需要放他人名片，需要放图像。
不需要放袁经，我觉得不需要放袁总吧。不是，他说的是需要不需要放那个工业部长制。
他的介绍那第2位的时候，需要放他个人信息吗？需要
放谁个人？不用吧。
他说话的时候不需要放头像和他的这个。
袁总就是开场放他的那介绍，
中间串场的时候都不需要。
串场的时候就
咱们倒回去那个尹总结束的时候，倒回尹总结束的时候，就是这样。
他结束的时候，你们尹总说话的时候，还是他那个拍照，还是画面。
这是我们前面说的。
咱们最后一遍就是尹总结束完之后，这个大图都会显示吗？
到时候会用吗？
他是要上线是吗？
不是，他是这样，他就是咱们合影的时候，是不是把他 logo 脸就拍照的时候把它传进去比较好一点？
我的意思是他上线对吧？
我们应该会不会是个5开头的那个 A5？
他要上线那就上呗，但是他得提前那个什么。
中间合影只能16个人是吧？
对。
你看所以你们这能呈现多少个人是吧？对，看人数。
因为很多人都是视频，不是认真上线。刚开始还是练一练，要不然从那过一遍。
那别太小，别让他看不见。
这个 Zoom 不是这个 YouTube 应该没啥问题，你就先关掉，咱们这儿那个。哦，我那光呀，应该没有。我说在一起在一起。把那个YouTube 先断掉嘛，等到咱们那个 rehearsal 的时候再开，把它先断掉。
把那个直播链接断了。
别待会儿还能上吧，反正就是同一个链接吧。对。
Human civilization travels through the plague. In this long human history, human beings often fail when facing infectious diseases until the emergence of vaccination. In the last 200 years, vaccination has played an irreplaceable role in reducing mortality and increasing the average life expectancy. The development of each new vaccine represents a great victory for human in the fighting against infectious diseases. Sinovac has never stopped to provide the vaccines to eliminate such diseases. While time advances, the challenge that human health is facing more and more complicated. When many diseases have not been completely defeated for many years, no matter it's SARS, avian influenza, hand-foot-mouth disease, or H1N1 influenza and COVID-19, the sudden appearance of these newly emerged diseases has sounded the alarm to human society again and again. While humans are fighting against diseases, they also witness the miracle when vaccines saves life. Every time, when facing uncertainty of a new disease outbreak and under great pressure, Sinovac always stepped forward and quickly joined the front line of epidemic prevention to contribute to the national as well as global disease prevention and control is the responsibility that Sinovac takes. Every single dose of vaccine carries the great expectations for an individual, a family, or even the entire society. In the laboratory, Sinovac's research and development team is rigorously and orderly carrying out the vaccine development every day to search for effective solutions to prevent and control infectious diseases. In the production plant, the production process in compliance to international standard and quality control system that covers the entire life cycle of a vaccine guarantees for every dose of vaccine from Sinovac, which deserves the trust of life. In the community, when Sinovac's vaccine is timely delivered and safely provided to people, it will provide effective protection. Through the research, development, production, and application of high-quality vaccine, SinovacBiotech's vaccine brings hope of bringing a healthy life to people and ensuring harmonized development of the society. Today, SinovacBiotech's vaccines are providing effective protection against infectious diseases around the globe. But looking into the future, Sinovac will make its best efforts to ensure the accessibility and affordability of human vaccines worldwide. Sinovac aims to provide more and more high-quality products. Sinovac allows more and more people to benefit from using vaccines. Sinovac supply vaccines to eliminate human diseases.
Okay. Distinguished participants, ladies and gentlemen, it's a great honor for Sinovac to have you join us today. I'm Yu Wei from Sinovac, the moderator for the opening session. Welcome you to the conference, Collaboration in Africa, COVID-19 Prevention and Control, working together with Sinovac. Actually, Sinovac sponsored this platform for health officials and experts to gather and share insights and thoughts on COVID-19 control. I would like to introduce our 4 prestigious speakers at the opening session. They are Mr. Yin Weidong, Chairman, President, and CEO of SinovacBiotech Limited. Honorable Dr. Abaruhman Jamel Lutfi Bambahmed, Minister of Pharmaceutical Industry of Algeria. Honorable Dr. Monica Musanero, Minister for Science, Technology, and Innovation of Uganda. His Excellency Dr. Mohammed Al-Badri, Ambassador of Egypt to China. Welcome all of you. Our first speaker is Mr. Yin Weidong. He was a doctor in China CDC at the very beginning of his career. He is the first scientist in China that isolated hepatitis A virus and developed vaccines successfully as early as 1980s. Based on that, he established his own company in 2001. That company is just called Sinovac. First, I would like to invite Mr. Yin Weidong, Chairman, President, and CEO of SinovacBiotech Limited, to deliver welcome remarks. Please, Chairman Yin.
尊敬的北巴赫迈德部长阁下、穆塞罗部长阁下、巴德里大使、奥马博士、哈萨尼博士、霍夫博士、各位专家、各位亲爱的合作伙伴、女士们、先生们，大家好！非常欢迎各位能够莅临本次新冠灭活疫苗最新进展和合作及使用经验分享的会议。我们携手非洲，科兴与您共同抗击新冠肺炎。这是一次 非常重要的学术会议。自2019年新冠疫情爆发以来，全球各国人民饱受折磨，而接种新冠疫苗已经成为预防新冠病毒感染发病的重要手段之一。由于疫苗在全球一些地区，特别是在非洲地区不公平的分配，我们认为只有通过通力合作，加强非洲疫苗供应和生产能力，才是战胜困难的最好办法。在此背景下，非洲联盟在2021年4月启动了非洲疫苗生产伙伴关系计划，以提升非洲国家疫苗生产能力，并制定了到2040年非洲疫苗生产制造业能够开发生产和应用非洲大陆所需疫苗总量的60%以上的目标。中国国家主席习近平在去年11月29日中非合作论坛开幕式上也提出，中国将再向非洲提供10亿剂疫苗，其中6亿作为无偿援助，4亿以中方企业与有关非洲国家联合生产等方式提供。这体现了中国对非洲国家的真诚合作态度。到目前为止，科兴已经在非盟和非洲地区近20多个国家获得了新冠疫苗的紧急使用。我们已经向10多个非洲国家和地区提供了近1亿剂的新冠疫苗，占非洲获得新冠疫苗总量的20%。同时，科兴的新冠灭活疫苗也已经顺利的在埃及、阿尔及利亚开始生产，并且已经上市，这都得到了两国政府的大力支持和当地民众的热烈欢迎。科兴将继续深化非洲各国在疫苗领域的全面战略合作，推进临床研究、本地化生产、技术转移、冷链仓储等多种全方位的合作，努力向非洲各国供应新冠疫苗，包括采用现在可能出现的新型变异株的新型冠状病毒疫苗，还有包括流感、甲肝等在内的其他非洲需要的疫苗。我们将用更多的品种、更多的数量向非洲提供疫苗。我期待这次会议能够让更多的非洲国家和人民了解科兴疫苗的科学数据、防控成果以及合作模式，期待更多的中国疫苗产品，期待更大数量的疫苗能够走进非洲，并在非洲生产落地，为非洲人民的健康安全保驾护航。再次感谢各国嘉宾的出席，也期待这次大会能取得圆满成功。谢谢大家。
Thank you, Mr. Yin, for your warm and insightful welcome remarks. From your speech, we can feel you have strong affection and strong commitment to our African people and willing to shoulder your business social responsibility. Thank you very much, Chairman. Our next speaker is Honorable Dr. Abarhuman Jamel Latfi Babahman, Minister of Pharmaceutical Industry of Algeria. He has recorded the video speech for us in advance, so please.
الرحيم السادة الوزراء، سعادة السادة السفراء، السيد المدير العام لسينوفاك بيوتك، سيدات والسادة الخبراء، سيدات والسادة الحضور، السلام عليكم ورحمة الله وبركاته. داجا خاو. إنه لمن دواعي سروري أن أتقاسم معكم بفعاليات هذا اليوم بهذا الحضور الكريم، كما أتقدم بخالص الشكر والتقدير للسيد المدير العام لسينوفاك بيوتك على الدعوة الكريمة لافتتاح فعاليات المؤتمر الدولي حول أحدث الخبرات في مجال البحث والتعاون والتلقيح باللقاح المضاد كوفيد-19. في هذا اليوم وهو يجمعنا لتسجيل نقطة تعاون وتشاور موجهة لا سيما للدول الإفريقية في مواجهة والتصدي لوباء كوفيد-19، خاصة ونحن جميعا في مسير مشترك من أجل التعاون والتضامن اللذان يعتبران أقوى سلاح للتغلب على الجائحة. وفي هذا الصدد نجدد شكرنا لسينوفاك على هذا الملتقى لتمكيننا من تبادل الخبرات في إدارة اللقاحات والتوطين والتجارب العيادية من خلال جهد مشترك وفي الظروف السائدة من جراء جائحة كورونا، في الوقت الذي يواصل فيه فيروس كورونا للانتشار حاصدا آلاف الأرواح وتسابق دول العالم للحصول على اللقاح. وإن مجابهة جائحة الفيروس تظل من الضروريات الحتمية التي دفعت بالدول لاستجابة متكاملة على الصعيدين الصحي والاقتصادي. وبلادنا كانت من الدول السباقة في اتخاذ تدابير استعجالية لاحتواء الانتشار السريع لهذه الجائحة بموجوها من الإجراءات، انطلاقا من حماية المواطنين إلى توفير وسائل الفحص والوقاية وإنتاج الأدوية والأكسجين. ومن المكاسب التي نفتخر بها والتي تحققت تبعا لتعليمات من رئيس الجمهورية السيد عبد المجيد تبون مفادها تكليف وزارة الصناعة الصيدلانية بأولويات عاجلة متمثلة في تصنيع اللقاح المضاد لفيروس كورونا بالجزائر ضمانا لسيادتنا الصحية واستجابة لمخطط التلقيح الوطني. وكانت الانطلاقة الفعلية لإنتاج لقاح كورونافاك في الجزائر بالوحدة الإنتاجية بقسنطينة إحدى ولايات الشرق الجزائري. هذه الوحدة التابعة لمجمع العمومي صيدال، مؤسسة عمومية تحت وصاية دائرتنا الوزارية، يوم 29 سبتمبر 2021، والذي أشرف بتدشينه السيد الوزير الأول. أيها السيدات والسادة الكرام، إيمانا منا بقدراتنا العلمية وإمكانياتنا البشرية ومن منطلق رفع الرهان الكبير، بدأت المفاوضات مع الشريك الصيني مخبر سينوفاك والمجمع الصيدلي لإنتاج اللقاح بداية من شهر ماي، وبدعم ومتابعة دائمتين من طرف لجنة قطاعية نصبت لدى وزارة الصناعة الصيدلانية، حيث تم الشروع في عدة تبادلات ومفاوضات مع الشريك الصيني من خلال اتصال مداوم بالتحاضر المرئي شاملا مختلف الأطراف المساهمة في المشروع من البلدين. وفي إطار الصداقة الدائمة بين الجزائر والصين والصامدة في وجه التغيرات والأزمات الدولية، وعقب استقبال رئيس الجمهورية السيد عبد المجيد تبون في 19 يوليو 2021 لمستشار الدولة ووزير الشؤون الخارجية لجمهورية الصين الشعبية خلال زيارته إلى الجزائر، أعطت هذه الزيارة دفعة إضافية لتتويج كل المجهود المبذول بالتوقيع على عقد شراكة في 25 جويلية 2021 بين الشركة الصينية سينوفاك والمجمع العمومي صيدال، وتسهيل تنقل الخبراء الصينيين لبلادنا، حيث استفادت فرق من المجمع مع تكوين تطبيقي ونظري بغرض تأهيل فرق تقنية في مجال مراقبة جودة اللقاح. وفي شهر أوت تم اعتماد الوحدة الإنتاجية بقسنطينة بعد تنقل الفرقة التقنية من شركة سينوفاك من خلال تأهيل المنشآت والأجهزة المخصصة لإنتاج اللقاح عبر التعبئة وإنهاء فيلانفيليش، إذ تم استلام الشحنة الأولى من المادة الأولية الضرورية في 27 أوت 2021. هذا ما سمح بانطلاق مرحلة ما قبل الإنتاج وفقا للمعايير الدولية، لا سيما تركيب أجهزة وتعميقها، وكذا إجراء التحاليل البيولوجية والبيوتك والميكروبيولوجية. كان استلام أول دفعة للمواد الأولية ب1000 لتر في البلك، يعني 1,700,000 من الجرعة مع الكواشف، بالتنسيق بين وزارة الصناعة الصيدلانية والمؤسستين تحت الوصاية مجمع صيدال والوكالة الوطنية للمواد الصيدلانية. هذه الأخيرة مكلفة بمراقبة جودة المواد الأولية والمنتج النهائي. إن القدرات الإنتاجية لسيدان تقدر ب 320 ألف جرعة في اليوم، ما يعادل 8 ملايين جرعة في الشهر، وهذا في ظرف 8 سوايع يعني في النهار، وبتوقعات قدرة إنتاجية سنوية تقدر ب 96 مليون خلال العام 2022 بشفت واحد. وبالموازاة لاستعمال تسمية كورونا فاك هناك مبادرتين تم تصنيفهما في إطار مواصلة حملة التلقيح. مبادرة أولى وطنية الجزائر فاك للتكفل بالمخطط الوطني للتلقيح من خلال تلبية الاحتياجات الوطنية المعبر عنها ب 65 مليون جرعة لضمان تلقيح المواطنين. ومبادرة ثانية بعدا قاريا أفريكا فاك لتلبية احتياجات الدول الإفريقية المجاورة في خطوة لاحقة في إطار التصدير. وقد تم شروع في تسويق اللقاح كورونا فاك لبلادنا خلال الأسبوع الفارط من هذا الشهر، وذلك بعد تسجيله والتصديق عليه فور خضوعه لمختلف الاختبارات التي أجرتها الوكالة الوطنية للمواد الصيدلانية في 30 ديسمبر 2021 فعاليته وسلامته. ونحن حاليا نواصل التنسيق مع المنظمة العالمية للصحة ضمن إجراءات تسجيل الوحدة الإنتاجية، وذلك من خلال تحضير كل المستندات الضرورية وفقا للتدابير المعمول بها على مستوى المنظمة للتسجيل ضمن قائمة اللقاحات التي اعتمدتها للاستخدام في حالات الطوارئ بموجب البروتوكول. وبعد هذه المكاسب القيمة والمسجلة في قائمة التحقيقات الكبرى لوطننا، نحن في صدد مواصلة دراسة مشاريع أخرى للتعاون والتضافر المستقبلي مع شريك صيني، والرامية إلى توسيع وتنويع إنتاج لقاحات أخرى ومتابعة نتائج الدراسات العيادية حول فعالية كوروفاك على المتحور الجديد أوميكرون، وإمكانية مراجعة الاتفاق بين صيدل وسينوفاك إذا ما تم تطوير نوع جديد للقاح في حالة ظهور متحور جديد آخر، مع مناقشة فرص التصدير المتاحة بتحديد قائمة الدول التي ستكون وجهة الصادرة للقاح بالتنسيق بين المتعاملين، وذلك لتفادي احتكار سوق واحدة. أيها الحضور الكريم، لا يفتني أن أنوه بأهمية العمل المشترك بيننا، إذ يعد من الضروريات الحتمية لمواجهة التحديات الحديثة ولتوطيد العلاقات التي تشكل بلا شك عنصرا هاما ضمن سياسة الدول في مواجهة جائحة الفيروس كوفيد-19 سواء كان على الصعيد العلمي أو الاقتصادي. وكما أكدها السيد رئيس الجمهورية عبد المجيد تبون، نحن عاكفون على مواصلة الجهود لتقوية عواصر الأخوة والصداقة وتعزيز العمل المتعدد الأطراف مع الدول، سواء كان على المستوى القاري أو الصعيد العالمي. وإذ أجدد لكم تحياتي الخالصة، فإنني وكل ثقة أن هناك آمال أخرى قادرين على تحقيقها بتعاوننا جميعا. وفقتم في أشغالكم وأشكركم على كرم الإصغاء.
Thanks, the minister reviewed the whole process of close cooperation between Sinovac in vaccine local production with the strong support of both governments. It shows how solid the friendship is between our two countries and the two companies. He calls for more cooperation in the future with Sinovac. Now, let me invite Honorable Dr. Monica Musanero, Minister for Science, Technology, and Innovation of Uganda, to deliver live speech for us. Please, Minister.
Thank you very much. I want to thank Sinovac for considering and having Uganda to be part of this meeting. It's a great honor to us. I begin by registering the appreciation of the government of Uganda to Sinovac for the gestures that you have shown in supporting us, not only by donating vaccine, but also by selling to us the vaccine and extending your interest in partnering with us in Uganda to develop our vaccine capacity development in the country. Globally, the COVID-19 pandemic has wreaked havoc on many countries, as we all know, and we were all shocked when a new disease came and we did not have tools to handle it. However, we also know that sub-Saharan Africa, this pandemic has exposed our great weaknesses and vulnerabilities in our strategies and planning, both in public health and economically. And this has been evidenced by the struggle by Uganda and many sub-Saharan countries to access vaccines, as well as other essential technologies. Of course, at the beginning, it was the availability, and later it became cost, because for us to really respond to COVID, it is very, very expensive, as we have to import all the technologies. For the government of Uganda, local vaccine manufacturing would reduce cost of vaccines, to help us to overcome vaccine shortages and to make Uganda better positioned to respond to outbreaks, and will be a way for our country to contribute to the global health initiatives. Our chronic inability to build local capacity within Uganda to produce critical tools for prevention and treatment of these diseases is no longer acceptable. And as we work and seek to partner with Sinovac, not only have we benefited from the work of the Chinese people, but we seek that we have partnership extended to support the people of Uganda to also be able to do research, develop vaccines, and produce them. So to this effect, because this is our ambition really, in April 2020, His Excellency the President of Uganda set up the Presidential Scientific Initiative on Epidemics as a mechanism to support Ugandan scientists to initiate the process of locally developing pandemic response tools, among which are vaccines. So we have started some work. 2 of our locally developed vaccine candidates have made good progress, and we are at various stages, not yet reached clinical trials. Given that this was a beginning, for us this clearly demonstrates that if we are determined and we have good partnerships, then we can be able to overcome the chronic dependence and also become a contributor to the solutions. In Uganda, over the years, we have tried to build capacity, both human and laboratory. One of our institutions, the Uganda Virus Research Institute, is one of the oldest medical research institutes in Africa, and it was previously Center of Excellence for East African Community. The institute currently has capacity to handle pathogens up to biosafety level 3, and we are in the process of upgrading to reach BSL 4. We also have quite good human resource at our universities and other research institutions. And apart from human vaccines, we have also built considerable capacity for animal vaccines. In preparation for moving to the stage of production of locally developed COVID-19 vaccines, we need to set up mini vaccine production facilities, which has the GMP certification by WHO that will enable our local vaccines to move into clinical trials. This facility will be used to produce the doses required to do the clinical trials. Uganda currently needs technical support from the global vaccine manufacturers, and we have previously approached Sinovac to support us so that we can venture at this stage. We are also aware that there is the initiatives through the African Union and Africa CDC, where different countries, including Morocco, Egypt, Rwanda, have signed MOUs with different international groups. Uganda has approached Sinovac for this partnership through the Chinese embassy in Uganda, and we are hoping that, that our request will result in a positive collaboration that will help to build Uganda's capacity. So we are seeking partnerships to help us to bring us to the level where we can be contributors. We all know that vaccines, much as they are commercial commodities, they are really a public health solution, and there are more countries that have capacity to contribute to these solutions when we reach such situations as we found ourselves in COVID, the better. And the lack of vaccine research, desire R&D, as well as production capacity on the African continent is a threat, not only to Africa, but to the rest of the world. Therefore, as part of my participation in this meeting, I am asking and seeking and stating the government of Uganda's request and need to partner and to be supported to receive technical support from the different, especially Sinovac, to support us. I want to thank you for giving me the opportunity to address you, and I hope we can work together on saving the lives of our people. Once again, I thank Sinovac for the great humanitarian work that you have extended, and I look forward for our nation building a partnership with you to build capacity for this great work. Thank you very much.
Thank you, Honorable Minister, for this speech. We have noted that you raised the need for Sinovac vaccines local production. We believe Sinovac will be your good friend, partner, supporter, and contributor in the future. Now, I would like to invite His Excellency Dr. Mohammed Al-Badri, Ambassador of Egypt to China, to give video speech. Please.
Presidents and ministers, Mr. Yen Weidong, the chairman and founder of SinovacBiotech, Ms. Helen Yang, the general manager of SinovacBiotech, Dr. Mohammed Hassani, assistant minister of health and population of the Arab Republic of Egypt, distinguished participants and guests. It is with immense pleasure that I am speaking to this very important and timely conference that is being held while our world is still struggling with the enormous challenges imposed by the COVID-19 pandemic. The common threats and challenges brought by the pandemic to all countries and the lives of the people around the globe have made it imperative for all humankind to stand together and mobilize all the resources to defend humanity against COVID-19 virus. I think that I will not be exaggerating if I say that amongst humanity's most valuable soldiers in this battle, both China and Sinovac are in the front line. China has been in the front line of the fight for the sake of the whole humanity since the humanitarian call and initiative by His Excellency President Xi Jinping, the President of the People's Republic of China, to make COVID-19 vaccines a global public good. This initiative was declared at a very early stage of the pandemic and before the launch of any vaccine worldwide, which reflects the strong commitment by China and its leadership to support the whole humanity against this unusual challenge. This initiative has been embodied by Sinovac's CoronaVac, which is the most administered COVID-19 vaccine globally, and with more than 2.5 billion doses, saving lives of millions and millions and actively contributing to decreasing the devastating impact of the pandemic. Distinguished participants and attendees, this call and initiative by President Xi Jinping has proven truthfully farsighted. As now, after almost 1 year of the launch of the COVID-19 vaccination campaigns, we can witness the huge gap and uneven distribution and availability of vaccines between different parts of the world. Thereby, my continent, Africa, remains the unluckiest and has the fewest shares, and as only 3% of the vaccine shots worldwide were administered in Africa. This unfortunate fact stimulated another generous initiative by President Xi Jinping during the last forum on China-Africa cooperation, commonly known as the FOCAC in Dakar. And the initiative this time was to provide 1 billion doses of COVID-19 vaccines to Africa during the year 2022. As Sinovac has already contributed to the embodiment of the vaccine as a global public good call, it also is holding now on its shoulders the great mission of participating in the implementation of the 1 billion doses for Africa pledge by His Excellency the President. A mission that I am confident that Sinovac will also be up to through hard work, clear vision, commitment to supply vaccines to eliminate human disease, which at the end of the day is the logo of Sinovac. Ladies and gentlemen, as for my country, Egypt, we are partners to Sinovac. Since the signing of the local manufacturing agreement between Sinovac and our local vaccine producer Vaxera back in April 2021, Sinovac has actively contributed to saving lives of Egyptians, building the capabilities of our local manufacturer and sharing ideas and innovation aiming at combating the pandemic. Through the effort of the women and men in Sinovac, racing the time, devoting all resources, making research, developing methods, making trials, and sharing experiences and knowledge, we all can rest assured that we have a fierce fighter on our side in the front line of the long battle against COVID-19 global pandemic. In conclusion, I would like to seize this opportunity to pay tribute to Mr. Yen Weidong, the chairman and founder of Sinovac, whose action, I believe, embody a true vision of what we may call a real humanitarian captain of industry. Also tribute to be given to Professor Dr. Mohammed Hassani, who somehow keeps abreast of all the developments regarding the pandemic, and his network with the African health community is instrumental in materializing the directive of my President Abdel Fattah al-Sisi, to turn Egypt into a hub for vaccine production in Africa and the Middle East. Ladies and gentlemen, thank you very much. And as we say here in China, xie.
Thanks, Ambassador. He highlights the Egyptian cold room donation agreement with Sinovac and hope This cooperation will benefit the whole region. Sinovac will always be the good friend of African continent. Thank you all speakers at the opening session for your passion, aspiration, and vision. Before we start next session, I would like to invite all speakers to turn on your camera and have a photo session together. Please.
我的还没开。来了，哎，光开我了，没有大家的呢。啊，来了。
大家可以在现在就结展屏。现在结了吗？嗯，是吧？一下有回放，有录。
啊啊，咱们那是啥？在那个 Live 谁呀？没开给他删了啊，这样好拍照啊。嗯，哦，行吧，好吧。啊，那个是巴西代理商是吧？啊，南非的啊，可以吗？
还有那个左边第三个，左边往下第三个那说拜拜，对，还是那两三个都是有。
哦，对，那个我认识，穿红衣服对讲上那是啊，张永军来了，啊，对，张永军好帅，嗯 ，OK， 好，大家鼓鼓掌啊，应该，哎，这怎么那主持人不对啊？主持人在那儿，对，嗯，对，
Now the opening session is concluded. I would like to introduce moderator for next session. He is Mr. Meng Weilin, Vice President from SinovacBiotech Hong Kong Limited. Let us welcome Mr. Meng. Mr. Meng, the floor is yours, please.
Thank you, Ms. Yuan, and thanks. So good afternoon for all the distinguished speakers and attendees. Firstly, please allow me to introduce myself. My name is Weilin Meng. I'm the Vice President of SinovacBiotech Hong Kong. And I will be the moderate presentation for today's second section. So next, we will have our first speaker. Our first speaker is Dr. Ala Abdel Fattah. And Dr. Fattah is Under Secretary for Preventive Affairs of Ministry of Health and Population of Egypt. And Dr. Fattah will deliver a speech about application status and safety and efficacy profile of CoronaVac in Egypt. So let's welcome Dr. Fattah. Dr. Fattah, the floor is yours.
Hi, it's a great pleasure to be with you. I'm Dr. Ala Abdel Fattah on behalf of Dr. Mohammed Hassani, the Assistant Minister of Health and Population for Public Health Projects and Initiatives. I will share with you the application status, safety and efficacy profile of CoronaVac in Egypt. First, we started vaccination of the frontline healthcare workers at Abu Khalifa Isolation Hospital at Ismailia Governorate on 24th of January 2021. Then we started the vaccination of the target population of the old age and chronic disease on March of 2021. Then we started the vaccination of all age groups at June 2021. This is the vaccination rate till yesterday at Egypt. Here is the consumption of the vaccination for the first dose in the blue color, 36.1 million, 24.1 second dose vaccinated, and fully vaccinated by 25.1 million doses. Then we booster dose administered 4,800 booster dose. Then special for the CoronaVac and Sinovac Vaxera, first dose administered 8.1, second dose 5.8, and for the fully vaccinated 5.8 also, and for the booster dose 65,000 doses. This is the administered vaccines. 23% goes for CoronaVac, Sinovac Vaxera, and the rest for the other vaccines like Pfizer, Moderna, AstraZeneca, Sinopharm, Sputnik, Johnson & Johnson. And for the stock, we have 71 million doses for stock, half of them for Sinovac and the rest for the other vaccines. Now we will talk about the vaccine registry and safety and pharmacovigilance. We have an automated, huge automated system started from the registration on the website. Once the subject registered, it opens automatically a medical record linked with the inventory and supply chain. This linked to adverse event reporting and the hotline service through the national ID or the passport ID. This is the pathway that we drew at the first. We imagined how the vaccination site will go. This is for the first dose pathway starting from the administrative and registration room, then to the consent room, then the first dose vaccination, and another pathway for the second dose. We considered that the vaccination site will be one way and the entrance is for the entrance only and the exit is away from the entrance to maintain the social distance and the preventive measures of COVID-19. The ways of reporting of any adverse event. Post-vaccination follow-up. This is a clinic. We have a post-vaccination follow-up in clinic in all the vaccination sites to report of the mild and moderate adverse events. Also, there is emergency units in case of severe adverse event and serious adverse event reporting, and pharmacovigilance reporting, hotline reporting, and telecounseling team. And we have an online application called Sahat Masr to spread the awareness concept about the COVID-19 vaccination. This is the manual vaccination card in English, and we have also another one in Arabic version. This is the manual vaccination. It has a logo of 100 million healthy lives campaign, presidential initiative. And this is the front page of the card, and this is the back in order to reporting any adverse event. And this is the automated QR card for the vaccination and mobile application if the subject need any mobile application soft copy of the vaccination card. Now we will talk about the adverse event reporting channels. Sorry. We have three reporting channels opened. First one, the hotline 15335. and the post-vaccination follow-up clinic, and the WhatsApp chatbot. Sorry. First, through the post-vaccination clinics, we have an automated system that reports through the vaccinator team. And the second way is the hotline for reporting any adverse event or serious adverse event. And the third one, the WhatsApp chatbot to easier communication. Then reporting channels, we have a telecounseling team that follow up any reported adverse event within 24 hours of the reporting through a medical professional team for investigation and assessment on the system. Now, the role of the MOHP pharmacovigilance team consists of 50 specialized doctors, and they are well trained on the pharmacovigilance, and they have a refreshment and periodical trainings on the pharmacovigilance and how to deal with the vaccinated population. They are following up the health status of any COVID-19 reported special cases, like pregnant, medically compromised, and healthcare workers. And they receive a daily reports for any reported adverse event through the WhatsApp number and the hotline. And this is a photo for some of them at their work. And this is how we train them periodically. This is a screenshot for the electronic system for adverse event reporting. It consists of reference number, the registration code, and the full name in Arabic and in English, the birthday, the vaccination site, with the first dose date and the batch number, and second dose with the second batch number. This diagram shows that all the adverse event reporting is integrated in one system, and finally it's be followed up and documented through the Egyptian Drug Authority, the EDA, in Egypt, to follow up any further cases with the causality committee. This is a reporting adverse event for the Sinovac vaccine. The number of reported cases post-Sinovac vaccination is 2,158 till 18th of January 2022. 77% headache, 12% fatigue, 15% fever, and 32 others like a rash, like mild symptoms, not all of moderate or severe. Now we will talk about the mortalities through 2021. There is 94% of the deaths were not vaccinated, but 2.6% were received the one dose, and 2.7% received the second dose, which means they were fully vaccinated. This diagram shows that the vaccine is very efficient for preventing the deterioration of any case. Regarding the COVID-19 disease severity among the vaccinated and non-vaccinated, through the home isolation, severity was 1.1 for the vaccinated population and the rest for the not vaccinated. And through the hospital admission, 1% only of the vaccinated goes to the hospital admission when he got COVID, and 1.2 to ICU admission if they have COVID-19. Thank you, and I hope you shared with you a good experience of Egypt.
Thank you, Dr. Fatah, for your presentation, your data sharing. Actually, as the vaccine developers, we are very glad to see large of our CoronaVac has been used in Egypt. And also very impressive to see this well-organized vaccination program in Egypt. And also quite glad to see the encouraging safety and efficacy data from this large vaccination program. So we are looking forward to the more comprehensive collaboration between Egypt and Sinovac, and hope more of our CoronaVac will arrive and contribute to the fight of COVID in Egypt. So next, I would like to introduce the second our speaker. He is Dr. Maxwell Mareza Av. And Dr. Av is the Chief Director of Curative Service of Ministry of Health and Child Care in Zimbabwe. And Dr. Av will give us the presentation with the name, with the topic as administration and collaboration experience of COVID-19 vaccine in Zimbabwe. So now welcome Dr. Av. Doctor, you are mute.
Dr. Hoff, you're mute.
Hello, I think you can hear me now.
You know, I can hear you.
Thank you very much, Mr. Meng. This feedback. Yes. Can you move to the other one? Okay, thank you. Let me thank and acknowledge the hosts of this conference, SinovacBiotech, for inviting us to make a presentation. And as the topic says, I am going to just give an overview of the administration and experiences of Zimbabwe with this COVID-19 pandemic. It's not moving again. Huh? So it's frozen. It's not moving.
Yeah, I guess your slide is frozen. Just in the first.
Yes, I'm trying to unfreeze. Stop sharing. Yeah. I just want one. Is it moving? Yeah. Okay. My apologies for the technology, but I will give a bit of background to our experiences here. Now, after the declaration of COVID-19 as a public health emergency of concern by World Health Organization in January of 2020, Zimbabwe decided to plan for the worst case scenario, and a national COVID task force was established. And this was headed by one of the vice presidents of the Republic of Zimbabwe. And they immediately, a preparedness response plan was established and launched by end of February 2020. In mid-March, the president, then in terms of our laws, declared a state of national disaster, and immediately also declared a formidable epidemic disease in terms of our Public Health Act. Now, the first case of COVID was reported in Zimbabwe on the 20th of March, 2020. And this was a case that was imported from London to one of our tourist centers. And then 3 days later, we had our first fatal case of COVID. Again, it was a journalist. We had traveled from New York. And on the 30th of March, Zimbabwe then declared a total national lockdown, which was initially for 3 weeks, but was extended with time. Now, coupled with the public health measures of sanitizing, social distancing, and wearing of face masks, we were able to control the COVID-19, the first wave of COVID-19 in September of 2020. That was almost 6 months after the initial case. The second wave then started just 2 months later, in November of 2020, and ended in February 2021. Because of the state of a national disaster that had been declared, government released $100 million US to purchase vaccines. The first batch of vaccines we received in Zimbabwe was 200,000 doses that had been donated by the People's Republic of China, and we really appreciate that. The vaccination program itself was then launched on the 18th of February 2021, and our honorable minister, who is also the Vice President of the Republic, was the first to receive the vaccines. Government went into an accelerated program of purchasing vaccines and vaccinating all eligible adults. The vaccination program has progressed very well so far, though slowly in some cases, and we have managed to vaccinate 34% of the target population in our country. Now, for Sinovac vaccine supply, this is our list of what we have received so far from Sinovac. We have received a total of 7.2 million doses from Sinovac, and we really appreciated the priority that we received in purchasing these vaccines, because we know that there was a lot of competition in the world for the doses. And the last consignment we received was actually a donation from the People's Republic of China of 1 million Sinovac doses. In total, we have received 7.2 million, but we are expecting 2.5 million in about a week's time, I think on the 29th of January. And we are also a beneficiary of the 1 billion doses that have been promised to Africa by President Xi Jinping. And we have been promised 6 million of the Sinovac vaccines. Now, in Zimbabwe, we have also started to vaccinate children. And at the moment, we are currently vaccinating the 16 to 17 years age group. And of interest is that these are only eligible for the Sinovac vaccine only, as approved by our Medicines Control Authority of Zimbabwe, because they are the ones that have provided the data for that age group. And we have also started giving them the third dose, and this was just approved at the end of December. And but this one applies to all vaccines in our country. That graph is just showing our experiences with the different waves, the 4 waves that we have experienced so far. And you can see that each wave, subsequent wave that was coming was almost 3 times in terms of transmissibility and intensity more than the previous one. Now, in terms of our legal environment, legislation on how we accept these vaccines for emergency use, we have our legislation there, Section 75 of the Act, that allows us to use these vaccines on an emergency basis. And these vaccines are examined physically and verified by the regulatory authority before they are admitted into the system. And the ministry also implements a safety monitoring plan, and there is a committee that is also coordinated by the regulator to monitor the adverse events following immunization. And we also take all the necessary precautions that are recommended by the manufacturers. For example, the taking precautions when vaccinating the 60 and above. And all our staff is trained before we use these vaccines. And they are trained in areas of storage, cold chain management, communication, surveillance, vaccine administration, the actual administration of the vaccine to the clients, and then investigation of the adverse effects, as we have said, and also monitoring and the evaluation of the entire program. So when we started this vaccination program, it was actually in phases. The first phase was to vaccinate the frontline workers, and then it was followed by the elderly and those with comorbidities or underlying diseases, and then the rest of the population followed, those who were above 18 years old. And we also concentrated on border towns and the areas that we considered to be hotspots. And as I mentioned earlier, the children are also now on board through Sinovac. This one is just showing us the vaccine landscape for Zimbabwe. We are currently using Sinopharm, Sinovac, Covaxin, and Sputnik. And those are the vaccines that are registered in our system and currently on the market. And in terms of our stocks, we are very fortunate and we indeed grateful even to Sinovac that we are not short of vaccines as Zimbabwe because we have managed to purchase adequate vaccines and also through our the donations that we have received. And so far we have over 18 million doses that we have received in the country. We have used 7.4 million, and we still have 7.5 in our vaccine stocks, and the 4 million there are actually circulating in the provinces and the health institutions and ready to be utilized. This is just to give an idea of the vaccination program. We have 10 provinces in the country, and this gives a breakdown of the coverage so far. But the overall, as you can see on the last line row there, we have vaccinated, fully vaccinated, approximately 34% of our target population, and 44% have received the first dose so far. And in absolute numbers, about 3.2 million have received they're fully vaccinated, and I think 4.2 now as of yesterday have received their first dose, and so forth. We have also started I think over 20,000 have received their third dose. This also is just showing the vaccination by province. Our target is 60%, and these are the percentage coverages. The orange there is the first dose, and the gray is the second dose. And so some of the provinces are almost reaching their 60% for herd immunity. The good practice, we enjoy very strong political support and commitment for our vaccination program. And the strategy is continuous monitoring and support and supervision, and use our multi-stakeholders and partnerships to try and drive the demand side of the vaccination. We also have our vaccination card is electronic and has been securitized and connected to the the Africa CDC network. We are still facing challenges of low uptake. This was initial, but even now, we are still fighting to improve, to mobilize people to get vaccinated as much as possible. As we speak, our storage capacity is full, and we are indeed very happy that at least we have the vaccines. Our major task is to try and mobilize people to get vaccinated. We are also working on our electronic data management system, setting up an electronic health record so that we can capture everything electronically. And we still have some hard to reach populations geographically, and also on a religious basis. There are some who are still not happy to get vaccinated. The vaccine hesitancy and compliance is still with us, but we are trying to do all we can to mobilize them to get vaccinated. The waste management and inadequate incinerators is also a challenge for us. And this is just to show the pattern of provincial involvement with this, or how the provinces were affected. This is, I think, for the third wave, and this one is for the fourth wave. And with the fourth wave, we are still in it, but we have managed to flatten the curve as much as possible. But the Omicron was very, very infectious. This one is just showing the admissions in hospitals, which were almost concurrent with the transmission as well. And this is the death rate in blue there. That's the curve for the death rate. And at some point, our health workers were very much affected. They were testing positive and going quarantining, and that actually worsened our mortality rate in the hospitals. This graph here is just showing, comparing the various waves, how they behaved. And just to highlight that in the first wave, we had a total of 7,771 cases and 227 deaths. And then in the second wave, it jumped to 27,000, and we ended up with 1,158 deaths. And the third wave, which was the Delta wave, this one was quite aggressive. We ended up with 95,121 and also 3,120 deaths. The fourth wave, which is currently in progress, we have just in 38 days, we recorded 82,000 cases, and we have only recorded 329 deaths, which also indicates the mild effect of the variant. These are the consolidated cumulative cases for us. 227,568 are the cases right from the beginning of the pandemic. And then we have 5,276 deaths to date. And this is the impact on our healthcare workers. The cases there are actually more because of the Omicron, but the deaths approximately 64 to date since the beginning of the pandemic. In terms of way forward, we intend to intensify the vaccination process itself, and to try and rationalize the distribution systems based on usage, and also involve the community, because the communities are the ones that assist us to recruit, to create the demand for the vaccination process. I would like to thank you for listening, and hopefully that we'll continue this good collaboration with the SinovacBiotech. Thank you very much.
Thank you, Dr. Huff. Thank you very much for your data sharing. Well, actually, it's quite impressive and to see, and already 34% target population has been fully vaccinated in Zimbabwe. But also, we can see currently Omicron strain still is a big concern for the population. And that also indicate the COVID-19 is not finished yet, and also encourage us to do more work, including the studies and the development of vaccines, and to against this Omicron COVID. And I'm also very glad to see the CoronaVac and make a great contribution for this 34 coverage of whole population. We will keep working with you and with your colleague and bring more vaccine to Zimbabwe, and also make our contribution to keep increasing the vaccination rate. So next session, I would like to bring several experts from South Africa, including Dr. Dloma and Professor Gray and Professor Aluwalia, and also Mr. Hilton Klein. But before that, firstly, I would like to invite also my friend, Mr. Hilton Klein. He is the CEO of Pneumolux Group. Actually, is our partner in South Africa. And Mr. Hilton will share with us the clinical study profile of CoronaVac in South Africa, and also he will be moderate the next South Africa section. And thanks, Hilton. I'll hand over to you. The video is nice, but without voice.
Okay. Thank you very much. We will play the video. Thank you very much, the Vice President of Sinovac, Mr. Ming. Thank you very much. The video sound, I think there was a challenge. We will look at that now. As Pneumolux, we would like to express our thanks and appreciation to the CEO and President of Sinovac, Mr. Yin Weidong, for his exceptional leadership and vision. He had to fight this deadly monster that is destroying our continent and also the world. We have never seen a disease so bad in destroying human life. But today we want to salute Mr. Weidong for taking on this fight to ensure that the people of the world are protected against this deadly monster, in particular, the people of Africa, and for initiating this esteemed symposium, a first of its kind between Africa and China, led by Sinovac under your leadership. This vaccine, as was heard, was the most administered vaccinated to the people of the world under your leadership. We have 2.5 billion doses already vaccinated people globally. And we want to salute you, Mr. Weidong, for taking the lead in protecting the people of the world. Allow me to introduce Dr. Konfi Moloko, a former special advisor to the Ministry of Health in South Africa, that will bring a word of greetings from the leadership of South Africa. Thank you. Over to you.
Good afternoon, Your Excellencies. Mr. Weidong, CEO of Sinovac, Mr. Hilton Klein, CEO of Pneumalax, Honorable Minister Abraham Jamel Lofty Ben-Hamed, Honorable Minister Dr. Monica Musinero, His Excellency Dr. Mohamed El Badri, Ambassador Extraordinary Plenipotentiary of the Arab Republic of Egypt and China, Dr. Mohamed Hassani, Dr. Maxwell Mazera, Hove, Professor Glenda Gray, Professor Ramnik Ahuliwalia, Dr. Wali, Dr. Fatum, and all those who are present. COVID-19 has and continues to have a debilitating effect on the globe, and in particular, our beloved continent of Africa. The loss of lives and livelihoods has been no starker globally than on our continent. I'm bringing you the greetings from the people of South Africa, and thank you for having made this symposium a possibility. The scheduling of this symposium, therefore, is timely as it brings into sharp focus the need for Africa to provide an African solution, not only I jumped something here. Not only this pandemic, but also so many illnesses and diseases that continue to plague Africa. Our solution is overarching, and of course, we must not be blind to the socio-economic issues, which are poverty, unemployment, and inequality. Allow me at the outset to congratulate Sinovac BioLife Sciences for their continued efforts in providing Africa with vaccine solutions, particularly in Africa. It is noted that Sinovac will be integral to China's commitment to deliver 1 billion COVID-19 vaccines to Africa. Furthermore, the collaborative efforts between Sinovac and Nomolax Group provides a demonstrable example of the traction now being given both in respect of BRICS and Sino-Africa relations in the areas of medical research, manufacturing, and the vaccine self-sufficiency we want to establish in Africa, particularly with the African scientific community in the lead. NUMLAC subscribed to South Africa's policy on the elimination of vaccine-preventable diseases on or before 2027 from the country. We hope that this commitment to vaccine use will result in South Africa and the continent making progress using existing vaccines and new innovations with proven efficacy. Africa has much to offer to the world in its scientific capacity and humanities evidenced by Ubuntu philosophy. The sharing of knowledge and research on a platform where all eminent academics play an equally important role in the development of cutting-edge technologies can only bode well for us as a continent. But more than collaborative research, I'm particularly excited about the prospect of Africa developing and manufacturing vaccines for itself. Vaccines for Africa by Africa. Again, I wish to commend Sinovac for its efforts in strengthening Africa's vaccine manufacturing capacity across various regions on the continent. It cannot be overstressed that these initiatives are timely, given the demand for vaccines continue to outstrip supply. Moreover, it will go to some way of reducing the disparity in access to vaccines between developed and developing nations. With these few words, a warm word of welcome to all of your participants and delegates to this auspicious event. I wish you every success with the deliberations of this critically important symposium. Thank you very much.
Thank you, Dr. Moloko. Ladies and gentlemen, now we would like to invite Professor Glenda Gray, the President of the Medical Research Council of South Africa, to greet you and to give you a word of thanks and appreciation. Professor Glenda Gray is one of the most esteemed professors in the field of medical research in our country, hence she leading the Medical Research Council, and we are honored to have her with us today, well known to the platform of Africa and the people of the continent. Thank you, Professor, over to you.
Thank you very much. Can you hear me all? I just want to say, can you hear me? Are you able to hear me?
Yes, we can hear you.
Great. Thank you very much. And it's very exciting to be on this platform and also very exciting to work with NUMLAC to collaborate in the area of COVID vaccine research. So for those of you who don't know, the South African Medical Research Council is the greatest African funder of medical research on the continent. And our job is to fund and conduct research that changes the lives of South Africans. And we're committed to capacity development and work very hard to make sure that we are growing a cadre of scientists that can innovate in the health sector. We're also committed to innovation and we'll work with various partners in public-private partnerships to develop vaccine capacity. In this end, we have worked with we are a site for mRNA, an mRNA hub. We work with BioVac and Afrigen to develop mRNA capability, as well as Patrick Soon-Shiong to work with his second generation COVID vaccines. But we're very excited also to extend our public-private partnership to the NUMLAC and Sinovac family, and are very excited to work with you to do vaccine development in South Africa. We have great capacity in both laboratory and clinical research, and we're also able to support a lot of the clinical development of your vaccine program. And to this end, we're very excited to work with Sinovac and NUMLAC to expand our knowledge of the coronavac vaccine in HIV-infected people in South Africa. As you know, we have the biggest burden of HIV at a global level, and we also know that vaccines don't work so well in HIV-infected individuals. And so it's going to be very imperative to evaluate the coronavac vaccine in South Africa in HIV-infected people. So we look forward to working with you both on this vaccine regimen, as well as future generation vaccines that Sinovac may develop. And so we're very excited to be part of this public-private partnership, and we are committed to supporting the work that is done by Sinovac and Numalux in our country, and look forward to further scientific collaborations, particularly in the whole vaccine spectrum from bench to bedside, and also to make sure that we support your innovation and your vaccine manufacturing in our country in any way we can. So thank you very much, and we're very honored to be part of this collaboration and look forward to working with you this year and in years to come. Thanks very much.
Thank you very much, Professor Glenda Gray. Thank you for your warm heart and your openness to collaborate with Sinovac and Numalux in South Africa and extending it to the people of Africa to enhance clinical research for our people. Thank you very much. I now invite to the podium Professor Dr. Ramrik Aluwalai, a physician and in health science systems, policy management specialist in South Africa, but also proudly to announce a member of the Numalux Scientific Advisory Council on vaccines as well as clinical research. Well-renowned, well-known to the people of South Africa and the rest of Africa. He's a specialist in his field, and we are welcome and happy to have him here today. He is supporting the Sinovac Numalux initiative and promoting it to the rest of the world. Thank you very much. Over to you.
Thank you very much. With all protocols observed, and greetings from Pretoria in South Africa to all honored guests. It is absolute pleasure to address you on this momentous occasion. I believe it's a critical conversation that we need to have as thought leaders in Africa and with China. I want to thank the Sinovac for facilitating the symposium so we can all say what we need to be said and hopefully ensure there's meaningful and real-time action. Esteemed colleagues, it has been evident since the dawn of time that Africans cannot be dependent on the West or the global world. And since 2020, when COVID came to the shores of Africa, we've had daily reminders and reality checks on our dependability on the global world for dealing with epidemics. We have unique genetics for our indigenous African community. And these genetics change from the north, south, west, and east of African as a whole continent. And what this COVID-19 has done, that it has provided us a brutal reminder of Africa that we cannot be left behind. And even until today, when global COVID-19 vaccination rates have been achieved as high as 80% or 70% of fully vaccinated in the world, Africa still has only 10% till date, which are people which are fully vaccinated. And similar action reminds us, as Professor Gray has spoken about, diseases that affect Africa, like HIV, malaria, TB, Ebola, and many more. And that is the reason where we need to be, as a continent, discussing about building our systems and structures. Time and again, we have found that the lack of collective action has meant that these diseases have impacted us in Africa more than any other part of the world. Most of the viruses, bacteria, and infections that impact us so heavily are preventable if there's a will to end of them. We have seen that collective will now when it comes to COVID-19. We have seen that vaccines have moved from rapid research and development, R&D, to an immediate production and distribution to the world. But there's a way to move us as Africa out of the malaise that we find ourselves in. Our longtime partner, China, has now shown interest in assisting us on this, and we're grateful. That will that we wanted is needed in our continent. The research and development capability is incredibly needed in Africa, and is there. Just look at our genomic sequencing capabilities in SADC, especially South Africa, when it came to the discovery of one of the two big variants of concerns like Beta and Omicron variants that were first detected on our shores and helped us inform the world faster about the dangers of these variants of concerns and save many lives. I have the privilege of working very closely with many South African scientific community, within which are some of the world's brightest minds and brains. So if we have the expertise, what is stopping us? R&D is critical for South Africa and Africa in general for finding solutions, preventions, treatment, and care of diseases, fighting epidemics and challenges that affect our own African population, our indigenous genetics. South Africa as a country is known for cutting-edge clinical trials. Let us use these resources within our world-class universities, our systems, and harness them to develop, with the help of Sinovac, with the help of Numalex, our R&D capabilities, and be the lead of the global world in health science scientific innovations. We are fortunate to have such strong linkages within our BRICS groupings: Brazil, Russia, India, China, and South Africa. We have seen the firsthand how we work together to draw attention on our common cause. At the World Trade Organization, WTO, India, together with South Africa, put a joint bid to remove patents around vaccine manufacturing. In October 20, the first proposal suggested a waiver on the implementation of certain provisions of the TRIP's agreement as far as COVID-19 was concerned. And in May last year, there was another proposal. This is where a Chinese partnership in backing Africa's plan to become a vaccine development and manufacturing hub becomes crucial. But this ideal is predicted on the support of the entire Pan-African system. The removal of patents would mean that we can adopt, modify, and manufacture vaccines in a far more cost-effective manner without waiting for the West or the global world to simply give us what we need in Africa. It is obvious that our own African nations and manufacturing capacity be increased, and thanks to Sinovac for putting this in their plan of action. This lag in a response has cost Africa enormously in the past. If the global world can look at Africa in non-vaccinated people and get them vaccinated, we have very minimal chance of mutations and more further variants that are being developed around the world at this moment and to stop COVID-19. We are making history in this time. We can't have vaccines be manufactured. We want vaccines to be manufactured in South Africa. We have economies like Nigeria and Egypt and many others that can build a similar infrastructure. The R&D, clinical trials, and end-to-end vaccine manufacturing chain should be owned by Africa. Human genetics are consequential, yet we are forced to accept vaccines that have not been sufficiently tested for people in Africa. We have about 363 million people in SADC countries and about 1.37 billion people across the continent. And that is where we want to move towards. We've seen yesterday history being made by the president of our country, officiating a launch of the NAMT-SA vaccine manufacturing campus in Cape Town, with the help of Dr. Patrick Soon-Shiong, the founder of the multinational NAMS Work LLC, has assisted to the launch of this coalition to accelerate South Africa's access to advanced healthcare. The aim is fast-tracking our domestic production of pharmaceuticals, biologics, and vaccines for Africa. The president has shared his vision, and with support of Shan Soon Siong Family Foundation, Institutes for Infectious Diseases and Cancer Centers of Excellence will be now established in around our universities in Western Cape, in Wits, Waterstand, and many other around to build this capacity. Knowing of all this, how can we not welcome this opportunity by China to invest in Africa to improve our research and development capacity? And let us play to our strengths as a continent. We know South Africa, we know Nigeria, we know Egypt, and all the booming economies in our country, in our continent, have the capacity to lead the continent on advanced research and development and clinical systems. South Africa and Numalex Group is ready in this step to take this country forward. Other countries can take the lead to support manufacturing for equal distribution. This will obviously require a Pan-African partnership and treaties to be drawn up. Let us shape our own future. An African future, a future where we can say our health matters, with the proposition put forward by the Sinovac and support from the Chinese government, our continent can step forward, knowing vaccine manufacturing will truly be you for the people of South Africa or Africa, by the people and of the people. Thank you very much.
Thank you, Professor Ramnik, for that beautiful piece of work, and we appreciate your participation and support to NUMALAX as you deal with the scientific clinical research program of the NUMALAX group in South Africa and Africa. We're now going to invite one of our most esteemed, known, and top virologists in our country, Dr. Sanet Aspinall, to do a presentation on the safety and efficacy of CoronaVac in children and adolescents in South Africa. As you are well aware, ladies and gentlemen, we are currently busy with a clinical study, a pediatric clinical study that started in August of 2021, approved by our esteemed regulatory body, SAPRA, in the age group of 6 months and 17 years. A team of over 270, including the NUMALAX group people, are involved in this clinical study, over 11 sites. I now invite Dr. Sanet Aspinall to give us an update on the CoronaVac clinical trial here in South Africa.
Mr. President of SinovacBiotech, distinguished guests, and all protocols observed, I thank you very much for the opportunity to, as the project director of this study on behalf of NUMALAX and on behalf of SinovacBiotech, to provide an update for you in terms of the global study, but particularly what is happening here in South Africa on this pet CoronaVac clinical trial. It is a multi-center, randomized, double-blind, placebo-controlled phase 3 clinical trial to evaluate the efficacy, the immunogenicity, and the safety of CoronaVac in children and adolescents aged 6 months to 17 years. Next slide, please. So as I said, it's a global multi-center study. The study is taking place across the globe in different countries. It's taking place in Chile, simultaneously with us here in South Africa. There's also a group that is working on this study in the Philippines and Indonesia, and I believe it will also start soon in Kenya as well. So the enrollment plan is specified by each country. So each country has a specific number of participants that they need to include in the trial. It is case-driven, it's randomized, it's double-blind and placebo-controlled. So participants do not know, and the investigators at the study, the researchers do not know what is being given, if they are giving activated vaccine, CoronaVac, or if they are given placebo, or if they are in the placebo arm. The study population is 14,200 healthy participants from the age group of 6 months to 17 years. And the ratio of the randomization is a 1-to-1, but each participant in the study receives 2 doses of vaccine of 600 SU, it's approximately 3 micrograms, or they receive placebo, except in Chile where the study is open-labeled. The immunization schedule for CoronaVac on this trial, and I believe that is also how it's been rolled out.
Dr. Sanet, I think the presentation is frozen. And also it's not in the showing model.
Excuse me, I can't hear.
The presentation is freezing.
The presentation is freezing. Oh my dear.
Stop and redo it.
Yes. Oh, the slides are freezing. Are you on the second slide, perhaps? So the slide where I'm busy now, the immunization schedule, 0 to 28 days. Eslin, can you put it into form?
It is in presentation mode.
Not yet.
Tristan, do you know how to put it in presentation?
Yes.
I'm not using my own slides. There's someone using it.
That's it. Yeah. So there's a presentation. Next one.
Can you see the slide?
No.
The screen is sharing.
Is it better now?
No, I think it's not sharing.
Presentation.
Okay. Yes.
You see the slide now? Thank you, thank you. So the immunization schedule in this trial is 0 and 28 days. So children are getting the vaccine at 0 days and then after 28 days, and the study duration is a maximum of 13 months that they are in the trial. Next slide, please. So the primary objective of this study is to evaluate the efficacy of a 2-dose coronavac against RT-PCR confirmed symptomatic COVID cases in the participants aged 6 months to 17 years. And the endpoint for the Sinovac study is the incidence of RT-PCR confirmed COVID-19 cases with onset of at least 14 days after the second dose. The trial will also evaluate a number of secondary and also exploratory objectives. So as part of these exploratory objectives, the efficacy assessments include obviously the surveillance for COVID-like symptoms. So during this whole trial, each participant are being phoned weekly to ask whether they have any COVID-like symptoms. There will also be laboratory confirmation of SARS-CoV-2 infection by RT-PCR, and all the PCRs are being conducted in the country at BARC laboratories. There will be a record of COVID-19 related hospitalization. So if a child lands up in hospital, that will also be recorded. Sinovac plans an interim analysis of the study when it's triggered after 47 confirmed cases, 2 weeks, at least 2 weeks or longer after the second dose. Safety assessments include immediate reactions within 30 minutes after each dose. So after each participant has been vaccinated, each child is observed for 30 minutes after each dose. The investigators are looking for local and they're looking for systemic solicited adverse events within the first 7 days, as well as unsolicited adverse events for at least 28 days in the safety subgroup. All participants are being followed up for adverse events of special interest, as well as SAEs up to 12 months for the full course after vaccination. The immunogenicity assessments that Sinovac is interested in will include the neutralization antibody assay as well as the S protein antibody assay. Next slide, please. So what is the progress to date in South Africa? So the trial obviously received, as Mr. Hilton has said, SAPRA and ethics approval. We started initially off with 7 investigator sites during the period of July, August, and the first enrollment commenced on the 10th of September last year. We started off with age descending enrollment, and that was used to establish the safety in all of these different age group cohorts. So we started off with the 12 to 17 years, then the 6 to 11 year group, the 3 to 5 year group, and South Africa, and I think in the whole world, we were the first to vaccinate the 6 months to 35 months age group. And we concluded 202 of these participants. So in cohort 1, we enrolled a total of 2,003 participants, and this was concluded up to December the 20th of last year in these 4 age groups. The participants are all under care of experienced investigators at these investigator sites, and because the trial went so well and because enrollment went quite quickly in South Africa, with the CoronaVac in the children, cohort 2 was approved and was awarded also by Sinovac R&D department to South Africa, and an additional 2,500 adolescents and children will be enrolled. And the second part of the study enrollment commenced on the 13th of January after we received SOPRA and ethics approval. So we are now 11 investigator sites that will enroll the 2,500 children in South Africa. So to date, we're very pleased to report that the vaccine is safe in all of these children age groups. No grade 3 or 4 adverse events were reported in the safety data reviewed by Sinovac in each of these age groups. Obviously, the data management will still be done on the local as well as the solicited adverse events, and we expect the same things that has been reported from some of the other speakers this afternoon, that it's fatigue and it's headache and it's a bit of fever, but it's very mild. So of the 2,003 vaccinated participants, we have seen only 5 serious adverse events, and they were all unrelated to CoronaVac. No suspected, unsuspected serious adverse events, we call them SUSARs, were reported, and the study is obviously ongoing with good retention of the participants. To date, the second dose has been completed in more than 90% of the cohort 1 participants. So in terms of COVID-19 surveillance, I'm very pleased to report also to Sinovac that we've had 432 presumptive COVID illness visits conducted at all of the sites participating in cohort 1. 78 of them were SARS-CoV-2 RT-PCR positive, and they were all detected during the 4th wave in December last year and the beginning of this year. And nucleotide gene sequencing were done on 60 of these RT-PCR positive cases, and they were all Omicron variant, the B11529, and 3 different Omicron variants, the 21K, the 21L, and the 21M, the BA1, the BA2, and the BA3 were detected. And I think this is very interesting also for Sinovac because of these variants that are circulating here on the African continent, not only just one Omicron, but different Omicron variants. And they will be learning a lot out of this study in terms of their own vaccine R&D program. So 35 RT-PCR cases already have appeared more than 14 days after the second vaccination. And obviously, the trial is working towards 47, not just in South Africa, but globally, also in other countries. And I'm pretty sure that Sinovac will be doing an interim analysis very soon, probably towards the end of this month or the beginning of next month. I thank you very much, and thank you for the opportunity to give an update on the trial.
Thank you very much to Dr. Sanet. Groundbreaking news. In Africa, the first 6-month-old baby was vaccinated successfully with the CoronaVac vaccine, and no serious adverse effects were picked up. So we can successfully say that this child, through the means of Sinovac, was vaccinated in Africa. What a great achievement. I'm now going to hand over to Mr. Anton Arendse to just give you a short brief on our vaccine manufacturing plant that are being established as we speak. Over to you, Mr. Arendse.
Good afternoon, esteemed colleagues, friends in Africa, and to our dear friends in Beijing, colleagues in Sinovac. Thank you very, very much for the invitation and for our participation at this very auspicious occasion. I'm going to talk very briefly. You can continue to the next slide. I think much has been said about the relationship in South Africa between Sinovac and the Numalux Group. We've heard about the approval of CoronaVac and its use in South Africa. Dr. Sanet has just talked about the very successful pediatric trial that is currently underway. Dr. Glenda Gray has talked about the anticipated study of CoronaVac on HIV positive candidates. And so the relationship between Numalux and Sinovac grows. And the next progression in that relationship is the enhanced research and development and manufacturing capability on the continent of Africa. Next slide, please. Next slide. Thank you. So much has been said about the scramble for this very scarce resource. This schematic is almost self-explanatory, and it shows the huge discrepancy between those countries who have access to COVID-19 vaccines and those who do not. You can press again, and it shows very, very clearly the huge gap. And I think it was Prof. Ramnik who indicated just the scarcity of COVID-19 vaccines on the continent of Africa. And it causes us to lag behind, not only in terms of immunity and life, but also our ability to sustain livelihoods. So not only is the gap ever increasing between developed and developing countries insofar as health is concerned, but also socioeconomically, that gap continues to expand. And therein not lies only the problem, but the opportunity for collaboration between Sinovac and many of its partners on the continent of Africa. I'm not going to spend too much time on this slide because so many speakers before us, not only the South African team, but other colleagues in Algeria have also talked extensively about the state of our vaccine capability on the continent of Africa. So colleagues, a huge opportunity exists. We've heard it from Algeria, we've heard it from Egypt, and even our colleagues in Uganda and Zimbabwe have talked about have expressed the concern around demand just completely outstripping supply on the continent of Africa. Next slide. To my dear colleague, Mr. Mung, this photo is not a schematic. It is not an artist's impression. It is in fact the actual building that the Numalux Group will occupy over the next few weeks. We have secured its occupation, and there we can give you a brief glimpse around about our planned capacity. Our first phase will be for bottling and labeling, storage and distribution for the continent of Africa. I've heard Hilton coin the phrase or the term vaccines for Africa, by Africa. That is what AfriVac seeks to achieve. And we want to provide the full gambit of services from the point of development, testing, through to manufacturing and distribution. And so a brief presentation on where we are in terms of our vaccine manufacturing capability over the next few months. Hilton, thank you.
Thank you very much to the Chief Operating Officer of the Numalex Group. We are grateful and thankful for this opportunity that we had to present. And I know much have been said by different countries on this platform. Much will be said after us and debated and analyzed. And now we need to pull the threads together. It is clear to my African brothers and sisters that we need Sinovac and China on the continent. Africa needs vaccines to protect their people against this deadly virus. And so through continued collaboration between Sinovac and Numalex and the people of Africa and attending participants, we shall continue to innovate, research, develop, and manufacture to create African vaccines for Africa with the assistance of Sinovac. Numalex would now like to propose the establishment of a Sinovac Africa task team made up by all participating countries on this platform. And I think its primary objective should be to strengthen our collaborative efforts with China towards research, innovation, development, and manufacturing. To the end, Numalex is very happy to host and be the interim secretariat of such an institution on the African continent to support Sinovac in envisioning the dream of the president of China to make available 1 billion vaccines to Africa as soon as possible. Numalex is happy to host this initiative together with our other African partners and countries on this platform to ensure that we envision this dream. Thank you once again to the colleagues of Sinovac, its president and CEO, Mr. Yudong, and the rest of our brothers and sisters on this continent. We now hand over to Mr. Ming, and thank you once again for this opportunity to serve the people of Africa and to save our continent from this deadly virus. I thank you.
Thank you, Mr. Hilton. Thank you, my friend. Well, also, we highly appreciate the kind word from Dr. Dloma, Professor Gray, and also Professor Aluwalia. And also, thank you, Dr. Sanid, for the current precise sharing about our pediatric clinical study. And also thank you, Dr. Anton, to sharing the great plan for the local production. As Sinovac, we are also looking forward to more collaboration in South Africa with our partner and all the stakeholders. And also, we are looking forward to more collaboration, including the clinical studies and including the local production. And also looking forward through such collaboration, we can bring our CoronaVac early to this country. So now, from the beginning until now, already 2 hours plus. So now we will enter to our break moment. During the break period, we will play several videos. It will take about 7 to 8 minutes, and then we will coming back. Thank you.
لحظة كانت عينينا على إن إحنا عشان نمتلك القدرة كان يمكن توجيهات فخامة الرئيس إن إحنا لابد من التصنيع المحلي للقاح في مصر بأي صورة من الصور. والحقيقة يمكن يعني في هذا الصدد أنا حابب إن أنا أوجه الشكر يعني الحقيقة الصديق الكبير حكومة دولة الصين على دعمها الكامل لهذا الموضوع. الحقيقة يمكن لما معالي وزير الصحة ويعني كل الهيئات اللي موجودة في مصر ابتدت يعني تسعى إلى موضوع تصنيع اللقاح، يعني تواصلنا مع يعني شركائنا في دولة الصين وهم الحقيقة مشكورين من خلال أحد الشركات العالمية اللي تنتج اللقاح في الصين وافقوا على إنتاج اللقاح في مصر. ويمكن النهاردة احنا شفنا مع بعض يعني المراحل الأولى لإنتاج اللقاح، ويمكن أنتجنا لغاية دلوقتي 1,000,000 جرعة.
And hoping this donation will play their roles in helping with mass vaccination efforts of Uganda.
The government of China has done a lot to support the health sector in Uganda.
We welcome the decision by SAPRA to approve the CoronaVac vaccine from China for use in South Africa.
The Numilux Group is on the forefront of fighting the coronavirus, creating employment and playing a pivotal role in the economic and social upliftment of those who need it most.
At this point, really, it's about soliciting whatever support we can provide, on the part of the private sector in supporting government in providing vaccines.
SinovacBiotech is committed to the research and development of a safe and effective vaccine
that protects people of all ages and backgrounds against COVID-19, especially in children, including those less than 12 years of age.
We are very careful in terms of the study, and we are very careful in terms of the safety, and it's already given to millions of children in China to date with no real big safety issues. So we are working with a safe vaccine.
In a groundbreaking world first in early November 2021, the youngest person ever, a 6-month-old baby, was vaccinated at our pediatric testing site in Cape Town. To date, that baby and none of the other children under the age of 2 who received the vaccine have shown any adverse reaction.
Most importantly for me was the opportunity to educate.
CoronaVac was approved for emergency use approval in South Africa. This approval implies that the CoronaVac vaccine was evaluated by South Africa's top scientists in SAPRA and found to be highly effective, safe, and of good quality. I would like to take this opportunity to thank the Embassy of the People's Republic of China in South Africa for giving their full support to the process.
With our state-of-the-art offices in Pretoria, South Africa, our highly skilled staff track all relevant progress through our war room, whilst keeping their fingers on the pulse of local and global developments. This development will undoubtedly have a positive economic impact on the local region, the country, and the continent. With Sinovac on our side, the Numulus Group is extremely confident that we will be victorious in the war against the coronavirus, especially amongst the children of South Africa, the continent of Africa, and the world.
Yep, welcome everybody coming back. And now we are going to the next section, the following the topic. So next, I would like to introduce Dr. Herba Veli. She is the next speaker. And Dr. Herba is the chairman of Vaxera of Egypt. And actually, the collaboration between Sinovac and Vaxera is the first production collaboration in Africa country. And currently, the collaboration is very successfully, and also the local produced CoronaVac already be used in the Egypt population. So today, Dr. Herba will talk about the inactivated COVID-19 vaccine localization program. Production and application in Egypt. Thank you, Dr. Herba.
Thank you, Mr. Meng, for your introduction. Actually, it's a great pleasure having this opportunity to participate in such a very important meeting, which emphasized the effort of Sinovac cooperation in the African continent, not only for supplying finished goods, but also for the technology transfer for the vaccine manufacturer. So I would like to take this opportunity to thank Sinovac delegation for their continuous support and their strong initiative to lead this effort. I would like to have a special thanks to Mr. Yan Wendong, the CEO of Sinovac, as well Mrs. Helen, the general manager. As well, I would like also Mr. Dr. Al-Badri, our ambassador of Egypt in China, for his continuous support and cooperation in order to make this project happen. So I am gonna make a brief or a presentation about the story on how we start our cooperation with Sinovac in a very critical time when the virus started to spread fast as well. We had the challenge at this moment concerning the limitation of number of doses which produce worldwide. So we start to think about work with a strong partner. So we start our work with Sinovac. I would like firstly to give brief about Vaxera and the vaccine industry in Egypt. Actually, it was start the vaccine industry in Egypt very early last century. We started the vaccine production in 1893 by a small lab for the production of smallpox vaccine in Egypt, and then go through different type of vaccine production like a rabies vaccine, tetanus vaccine, smallpox, and cholera vaccine. It was in 1947. All of this was a lab for the production of vaccine. In 1973, we established an organization for the production of biological product and vaccine. And then in 2002, this organization is shifted to holding company. It is a state-owned company by the government, owned 100%, with a mission and vision to contribute securing the need of the country from human vaccine and veterinary, as well as the biological and the blood derivative products. So Vaxera, we have three places in Egypt. One is the headquarters in Cairo and two sites outside Cairo. And also Vaxera is a part of regional largest network of the vaccine manufacturer, which DCVMN, ANDI, AVM, and also we have two reference labs for WHO, one for the polio regional reference lab as well flu reference lab. And this is the portfolio for our products, which we are producing locally. So we will find that we had many different types of vaccine through technology transfer agreement as well. We also specialize in the production of anti-sera like anti-snake, anti-scorpion, and anti-tetanic. So now I'm going to give a brief about COVID vaccine production in Egypt. Actually, it was a success story, I can say like that. And this is the roadmap for the production. So we started the negotiation with Sinovac from June 2020, and almost about 10 months after that, we signed the agreement with Sinovac, which was in April 2021. In May 21, we had the bulk supply as well, the technical supporting team coming and reach Egypt. We had a training through from May to June and assessment for the facilities. And then by the end of June, we start the production of 3 successive batches to have it for the stability study. And then we prepared the CTD file to send to the regulatory authority. It was in August 2021, getting the approval and EUA for using the product and release to the market. So it was 123 days for the complete of the phase 1 of bulk ready to fill. So through this time, we had a lot of working hand in hand with complete support and the technical supervision from Sinovac in different areas, in the production, in the QC, in the QA. We had a very comprehensive training program with the colleague coming from Sinovac. So they make the training as well, they make the facility assessment to check the comparability with the steps as well they have in their facility. So this is the production facility which we are talking about. So the capacity for the filling was it is 6,800 vials per hour, so almost 100 million doses per year. And the total area 1,000 meters square. It's 4 floors, and it is allocated for the filling of COVID vaccine coming from Sinovac. This is some picture coming from the area, which shows different zones for the production. So you can see area C, area B, filling line, and also the utilities. This is the story for the production. So as Egypt is the first country in the African country or African continent to succeed in manufacturing COVID vaccine with Sinovac, we will find that by starting in April 2021 and by December 2021 through different stages. So now we had the production of 30 million doses of vaccine, and also we have about 15 million doses we are gonna to fill in the next 3 months. So it will be ended by March 2022. This is some steps from what we have, starting from receiving the bulk coming for in Vero container, which is controlling the temperature of the bulk during the shipping process, because we need to be sure from the quality, safety, and effects of the vaccine. So the logistic around the transportation of the vaccine is very, very important. As well, this is the filling process and the QC and the QA for the production process. As well, now also we prepare for getting the EUL from WHO. So we have a site visit from WHO expert. It was in 2020, and they give positive opinion about the facility and about the quality system. In March 2021, we had the roadmap for COVID vaccine production by WHO expert. So they start to review all the system, the production area, the QA, the QC procedures. And from September 2021 to December 2021, we have WHO training on the EUL file preparation as well. The consultant from WHO, he reviews all the technical document and record during the production of the 30 million doses of the vaccine. In November 2021, also we had a visit from WHO expert. They goes with us during the production, so they spend a lot of time in the production facility. They check every steps. So it's just a visit to be sure that the production also went in a good manner. Our future plan, we had a new plant for the production for the filling of COVID vaccine. So the total capacity will be 24,000 vials per hour. So we expect to have from 300 million to 400 million doses per year in one shift. So we have now the initiative from African Union 2040. So we have the initiative to reach 60% of African countries' vaccine need to be locally produced. It's not only for COVID, but also for other type of vaccine. So we work very hard with this initiative for satisfying the need of the African continents. And also we have a visit from Africa CDC, Dr. Niguez and Dr. Ahmed. So he visited the facility for the production, for the filling of a COVID vaccine, as well as a storage room for which we have it. Now I'm going to talk about the future cooperation between Sinovac and Vaxera. It's not ending to have bulk ready to fill, but now we're talking with them in different areas. And for this year, just 2 days ago, we signed with Sinovac cooperation agreement for preparation for a new logistic cold room with a capacity of 150 million doses of the vaccine on area about 3,020 meter square. So it will be a fully automated one with a management system to be sure for the good storage practice of the vaccine. And also, not only for that, but also for we talk about the technology transfer, complete the technology transfer project. So now we talk with Sinovac on upstream to make the full technology transfer, and we expect to have it in 2022. So thank you very much, and I hope that I cover all the points and I'm trying to share such experience with Sinovac, as we can consider it is a success story for the technology transfer, and looking forward to have this year more and more. Thank you very much.
Thank you, Dr. Haba. Indeed, it is a very successful collaboration model between Sinovac and Vazkeira. Well, and also very pleased to see, and up to now already 30 million doses of CoronaVac produced locally. And just you mentioned that we are also looking forward to more collaboration, including the cold chain storage, and also the research and development and further production. We believe by further collaboration, including the full technical transfer, we can make a better future in Egypt, also in Africa. So next, I will introduce another successful model coming from Algeria. I will invite Dr. Fatah Aksem from Algeria, and to give us another good success story. And Dr. Aksem is the CEO of Sadel Group from Algeria. And Sadel Group is also Sinovac partners. We do the local production collaboration in Algeria. So next, I'll hand over to Dr. Aksem. Doctor, you are mute.
Did you hear me?
Yeah, very clearly.
Good morning. Can you share, who is sharing the slides?
So the slide is not shared by you, right? Oh, coming out.
I did send them. Did you see them?
Yeah, I see the slide. Just in full screen showing model.
You would like to see it in this full screen, or like this is better?
Yeah, but it's better to present as a showing model.
Excuse me, did you hear me?
Yeah, I can hear you.
Yeah, is there any problem for sharing the slides?
Yeah, the slide is fine, but it's not showing in a full screen. You can put the button on a...
Yeah, no, you would like to be in a full screen like that?
Right.
Is that correct?
No, it's not changed. You can put the button on the right side, right down.
Is it correct for you? Hold on, please, hold on.
Yeah, you're mute, doctor.
Are you seeing the slide? Is there any problem with my slides?
There's no problem with your slide. It just this showing model is not in a full screen. So you can see in the bottom, in the right bottom, there's full bottom,
yeah.
Full button.
Yeah.
you put
Yes.
the last one on the right side. You see is in a percentage 46. Just
like this. No. Which one?
doesn't work. No, it's
It
no
doesn't
slide.
work.
It's there is no slide.
No slides.
No.
No slides.
Coming out. I'm back. Yeah. Well, maybe you just go on with this and.
But is there any problem? Are you seeing my slides, please?
I see your the slide.
Okay. Can I start?
Yeah. Go ahead.
Okay. Thank you. Good morning, everybody. And thank you for inviting us to this very important meeting. And I would like to thank Mr. Yin and all the attendees and the partners who are in this meeting. And I'm just happy to come just after Vaxeria. And that means that we are going through the same success story. We came after them in that success story, and I would like to share this success story. Before sharing this success story, I just have some few slides regarding who is SIDAL. As a CEO of SIDAL, I am trying to present to the SIDAL and to have the opportunity to share with you the success. Hold on, I would like to see if il ne voit pas tout là. Il ne voit pas la slide, il ne la voit pas totalement. Il la voit pas.
On pose.
Non, mais je pose. Non, c'est bon, il est en train de voir. Ok, c'est bon. Je vais le partage. Voilà, le pourcentage. Là, ça marche pas. Okay. Did you hear me?
Yes.
Hello? Oh, I'm sorry. Hello?
Yeah, we can hear you.
Yeah. I'm sorry for this disturbing. I was for 2 hours. I was waiting for my turn, and now that it's my turn, things are going wrong. It's not.
I'm sorry for that.
Okay, and to have the opportunity to share with you the success story, to introduce to SIDAL and tell you about the implementation and the realization of a project, which is my opinion is one of the most important, because for us as SIDAL, it is the first time that a vaccine is produced in our Algerian company. And to provide a solution for the patient was a big challenge to us in this difficult condition and the national scope, with the support of the high authorities of the head of this Excellency, Mr. President, Mr. Abdelmajid Tebboune. But first, let me introduce SIDAL to you to see who we are. SIDAL is the first pharmaceutical laboratory producing generic drugs in Algeria. Established in 1982, its main mission is to develop, produce, and market pharmaceutical products for the human use. Since 1999, SIDAL has been listed on the Algerian Stock Exchange. The term, just going very quick on this presentation and go to the main issue of this meeting is about the Sinovac collaboration. But what are our missions? Our mission is to provide patients with a rich and advertising range of quality medicines, contribute to improve patient access to treatment by adopting a pricing policy covering broad layers of society, support public health because we are 80% state-owned and 20% in the state share. We are the supporter to the development of the pharmaceutical industry by choosing the right investment in line with the evolution of medical care. Ensure the permanent availability of drugs. Which are our infrastructure? We have 7 production sites located in different areas of Algeria, in Algiers, in Medea, in Constantine, and in Annaba. These factories have an average annual production of 300 million sales units, You have some few pictures of most of them. And 3 regional distribution centers located one in Algiers, one in the east of Algeria, meaning Batna, and one on the west of Algeria, Oran, ensuring the distribution and marketing of our Saidal own product through the territory. Okay, our infrastructure, also we have one research and development center and the first bioequivalence center in Algeria. Okay, and our exportation also is one of our strategies. Saidal in the past has operated timid export action through participation in tenders, but currently with its infrastructure, qualified human research, and as part of the application of the government's guidelines to promote non-hydrocarbon export, Saidal intends to strengthen these actions by taking new measures to conquer, be present, and actor in the regional and African markets, especially since Algeria has various freight transport infrastructures, ports, airports, roads, and rail network, as well as logistic platform. And now we come to the main issue of this meeting, is this success story of the vaccine and Sinovac partnership. Like other countries in the world, Algeria has been heavily affected by the COVID-19 pandemic, and many of our fellow citizens have died following complications due to the coronavirus. To this end, to deal with this, Algeria first had to seek to acquire the vaccine, something which has been very difficult. In February 2021, the President of the Republic gave an order for the production of the vaccine in Algeria, and a mission which has been assigned to Saidal. From that moment, Saidal established these needs, in particular, the orientation of move toward a traditional technology vaccine, that is to say, with an attenuated or inactivated virus. Contact several technology donors to get an idea of the type of equipment used and the possibility of using existing equipment at one of these sites. Then it turned to the search of a vaccine producer partner, and it is in this context that it's focused with the support of the political authorities in the first place toward friendly countries, and in particular China, which Algeria has had a lot of collaborations, especially since the start of the pandemic. And therefore, the first contact has been established with Sinovac. As soon as Sinovac agreed to locate the production of the CoronaVac vaccine in Algeria, and given the importance of this project, the Algerian Ministry of Pharmaceutical Industry has set up an intersectorial committee for the support of the localization of the vaccine. In this purpose, and in June 1921, the first is there anything wrong?
Yeah, I guess
Hello?
the translation, there's some problem with the translation.
I'm sorry. In this purpose, and in June 2021, the first exchange were on the technical aspects for the fill and finish in the one of the existing units of Saidal based in Constantine 1. In view of the time allocated to the project, in particular the deadline of September 21, and this was really a big challenge for us, time being short, a race against time has begun with the assistance of Sinovac to identify the gaps and acquire them as soon as possible. In meantime, discussions were initiated on the commercial aspect, and a contract was signed on July 25th, 2021. In July 27, meaning 2 days after, an audit was conducted by Sinovac experts on SIDAL facilities in Constantine. These are the pictures of the experts visiting the site. Oh, hold on. A CAPA plan was drawn up and implemented by a mixed team, SIDAL, Sinovac, who worked tirelessly to lift all reservations noted by the auditors. Acquisition of all the equipment necessary for the control of the vaccine, not available at that level of the production unit, since it is the first time that it produces the vaccine. All this record time in view of the international environment linked to the COVID-19 pandemic. In August 27, 2021, where we received the first bulk of vaccine. The bulk was controlled by our quality control department, and some control have been outsourced and carried out by National Agency of Pharmaceutical Products. In the September 29, 2021, this is a very historic date for SIDAL. The fill and finish product of the vaccine was launched by the state authority in the persons of the Prime Minister and the Ministry of Pharmaceutical Industry in a great ceremony at which took part His Excellency, the Ambassador Chinese Ambassador in Algeria, and the General Manager of Sinovac Group by video conference. These are the first launch of the Sinovac. Here you have the Prime Minister, the Ministry of Pharmaceutical Industry, and me. Here the Prime Minister, and here the Ambassador talking. And here is me talking at the Ambassador of the Chinese Ambassador. The process validation batch done, the stability ongoing. In December 16 and in 17, 2021, we were honored by the visit of the Mr. Qiang Gao, Sinovac General Manager, to our facility in Constantine. They are visiting and doing the laboratory control and the filling and finish unit. And December 30, 2021, marketing authorization was obtained. Now we are ready to manufacture and sell the product in our domestic market. Supported by our partner Sinovac, we have also started the process for a WHO pre-qualification, which will certify that the vaccine is produced meeting the international standards and will enable us to export it with a close collaboration with Sinovac. Our ambition and perspective is to make our vaccine available to Algerian citizens, support health policy of Arab and African countries if needed or asked for to fight this scourge that is the COVID-19 pandemic, of which vaccine is the most effective means to date the eradicated it. And I thank you. Thank you everybody, and thank you to let me show you this successful story with Sinovac.
Thank you, Dr. Akram. Actually, I still remember the great collaboration between Sinovac team and also the SIDAL's team regarding the details plan to address those CAPAs, those observations from the audit. And also it's great to see, and currently all the CAPAs adjust, and the production are running smoothly in SIDAL. So actually, besides of those collaboration regarding the local production in Africa, actually we also collaborate with many global partners regarding the research and development, including the clinical studies. So next, I will invite my colleague, Mr. Eric Gao. Mr. Eric Gao is our medical director, and he visited Turkey for a long time to work together with our partners for some local clinical study there. So today, Mr. Gao will sharing us with some updated clinical data regarding CoronaVac. So I'll hand over to Mr. Gao. Thanks.
Okay. Thank Mr. Meng for the introduction and also for the opportunity to share the latest clinical evidence of CoronaVac, which made by Sinovac. So, okay, Sinovac is, I think, is working with full speed to fight against the COVID-19 in the pandemic. So in 1 year, Sinovac or CoronaVac got the conditional market approval, and also just in 1 year, Sinovac has reached a production capability of 2 million doses, and in 300 days, CoronaVac has been distributed globally, more than 1 billion worldwide. And this is based on a lot of efforts from the whole world, I think. So far, by January the 13th, CoronaVac has been granted emergency use and also conditional marketing authorization by 57 regions or countries. So this is also based on global evidence of CoronaVac to show that the CoronaVac has a good safety, immunogenicity, efficacy, and effectiveness to prevent COVID-19. So for the pediatric population, from here, we can see according to the result based from phase 1, phase 2 clinical trial. So the overall incidence of adverse reaction is about just 20% to 30%. And the AR are mainly grade 1 and grade 2. The incidence of AR grade 3 is also very low. And compared with the placebo group, there was no significant difference in the incidence of adverse event in the vaccine group, besides some injection site pain. And the main adverse reaction symptoms are just injection site pain and fever. And for the population like pregnant and postpartum women, so this is a evidence from real world, and this is a study done in Brazil, and the data shows that the overall incidence among this specific population, the overall incidence of adverse event is about 74%, 74 per 100,000 doses. And also the CoronaVac has the lowest incidence of AE among the 4 available COVID-19 vaccine in Brazil, just including Pfizer, BioNTech, AstraZeneca, and Janssen. And also for the severe adverse event, it also is the lowest among all those 4 types of COVID-19 vaccines. And the most common maternal AE is spontaneous abortion, and the most common systematic AE are headache and fever. For another specific group, like people living with HIV, so whether it's after first dose or second dose, only mild adverse event was observed or reported during the whole study. And if we take further another real-world evidence from in China, it also said that CoronaVac also has a very good safety profile for the people with chronic disease. So the percent of the people reporting adverse reaction in different disease groups were quite close, just raising from 40% to 18%. And the adverse reaction were mainly grade 1, grade 2. No grade 3 or above AE were reported during this study. And also CoronaVac showed very good immune persistence, whether it's for second dose or third dose, we call that booster dose. For the 2 dose, we can see from this graph that the population, the pediatric population has a better GMT or GMT level than other groups, whether it's elderly people or adult. And also even after 6 months, here we can see for GMT is still about 20. So that says that CoronaVac has an even better performance in the pediatric population. And this graph shows that even after 1 year, that's 52 weeks, the CoronaVac still has a higher GMT or seropositivity among the vaccine group. So, and also this is done by in the pediatric area. So it also says from the phase 3 trial in Brazil. So this is also another evidence to show that the persistent immune for CoronaVac. And another study shows that the boost dose, I mean the third dose, is also shows a higher GMT level for the people even after third dose for 6 months. That if we compare the level after 6 months, I mean after third dose, is still higher than the peak of the 2 dose, whether it's in adult group or in elderly people. So this is another evidence to show that CoronaVac has a longer persistence after third dose. And also we have some evidence to show that for the CoronaVac after both dose, the neutralizing antibody type induced by a third dose is more comprehensive. So we have result to see that after third dose, there's a broader spectrum of neutralizing antibody. So this is also another evidence to show that, to support that for the third dose, we have a better immune response and also lasts long. And a study, a real-world study in Chile also proves that for booster dose or third dose, we have a higher strong immunity to protect symptom cases or hospitalization. So for the symptomatic COVID-19 cases, it's increased the effectiveness from 56% to 80%. And for the protection of hospitalization, it increased from 84% to 88%. So this is just some evidence to show that CoronaVac has some longer immune persistence. And if we take into the real-world study or real-world evidence, so it also shows that CoronaVac works very well. This is evidence from another very well-designed study in Brazil. We call that Project S. It's a study done in town of Ceará in Brazil. It's a step-based cluster randomized controlled trial. So because from this study, we see that the vaccine effectiveness in real world is very good. It's also even better than the results from the phase 3 clinical trials. For the effectiveness to prevent symptomatic COVID-19 is about 80%. For the hospitalization is about 95%. And for the death is also about 95%. So this say in the real world is confirms the protection effectiveness of the CoronaVac. For another study in Chile is also confirms that this study is based on a cohort of 10 million people. It's based on a study on the National Insurance Province database. So the result of the CoronaVac to protect symptomatic, it tends to be 65%. So for the hospitalization, it's about 87%. For the admission or the death is about 90% and also 86%. So this is based on a very big, or at that time is the biggest cohort to show that, to confirm that CoronaVac has a better protection effectiveness in the real world. And also for this study, our friends in Chile followed just not just for 1 time, but also for 3 times. So all of the 3 times analysis all confirm that CoronaVac has a very good or better or good effectiveness to protect people from severe disease, whether it's hospitalization or ICU or death. It's all more than 80%. And besides those kind of evidence in the real world, We also have other ongoing research. I'm going to talk about the multi-center phase 3 clinical trial of CoronaVac in South Africa. Just as Mr. Helton Collins said, I will not go to the details about this study. So far, I want to emphasize from this study, the preliminary safety result has shown that the overall incidence of adverse reaction was similar to the result we see from phase 1, phase 2 clinical trial, just I mentioned at the beginning of this presentation. And also, I just also heard from Mr. Helton Kevin that so far, no severe adverse event was reported. So this is a very exciting news that tells us that CoronaVac, when used in the pediatric population, is very safe. And also tell us that whether which races, it also proves that you can use that. So this is a very great study, and is also going on. We hope that we can have the more results from this study, especially the efficacy. So, and also based this evidence we discussed. For example, phase 1, phase 2 study about the safety and immunogenicity, and also other data like our efficacy and effectiveness study results from phase 3 study, and also real-world study just mentioned before, come together. More and more country or region has granted CoronaVac emergency use or conditional market authorization. For example, we have Chile, we have Indonesia, we have Cambodia, we have Malaysia, and so Cambodia, Zambia, and also China, Hong Kong. All these countries, region has granted the use among the pediatric population. There are some difference between the age group, but all those health authorities has confirmed the safety and also the potential, we call that efficacy or effectiveness of the CoronaVac in the pediatric population. So this is also evidence to show that yes, CoronaVac works for the pediatric population. It should be used widely, globally. And also, even though we have so many updated clinical evidence, we know that we still have some scientific questions should be answered. For example, how about the impact of Omicron strain on the CoronaVac? And also, how about the efficacy and effectiveness among the pediatric? Even though I have given some very brief introduction, but also we need more and exact numbers about the efficacy and also effectiveness during this among this pediatric population. And also, how about the performance about the boost dose, and also the persistence of the boost dose, and how we define the immunization schedule for specific or special populations, and also the immunogenicity of heteromotic vaccination with inactivated vaccine. So still there are a lot of questions we can work together to study, to answer. So this also means that we have opportunity, because we all know that CoronaVac has been distributed globally. That means that we will have more field to study those questions. So basically, this is what I want to share to you about the latest clinical evidence. So thank you. I hope that we can discuss further for those kind of issues or topics. So thank you.
Thank you, Eric. It's indeed a very comprehensive data sharing about the clinical evidence of CoronaVac. So from those slides on the data, we can see CoronaVac has a very excellent safety profile. And I think that is also the reason why so many countries approve CoronaVac for pediatric use. And some countries, CoronaVac is the only vaccine used in pediatric group. And also the good immunogenicity and good immunogenicity persistence, also very impressive, such as the data in Brazil and also in the pediatric group. And most, I think, impressive data coming from the third dose boosting. The broader antibody induced by the third dose maybe can give the better protection to the others variant, including the Omicron. But we still need more data and to show this. And also, we also see a very encouraging real-world data from both Brazil and Chile, and shows that actually CoronaVac did a great job and to prevention the COVID-19 infections. So thank you very much, and also appreciate the clinical research team, and also appreciate all the scientists what the scientist has done for the studies. Next, so I think up to now, we already finished all the presentation from the different experts, and also the data and the collaboration. And so now we are ending to our ending section. And first, I would like to invite Dr. Nikis Nadby from the Africa CDC on behalf of Dr. Oma to give our first ending speech. Dr. Nadby, now I hand over to you. Thanks.
Thanks so much. First, accept the apologies from Dr. Uma Ahmed. He is presently in the Permanent Representative Council meeting, which started today ahead of the AU Summit, which is on the 5th and 6th of February. Please accept his apologies. So I have 3 things from Dr. Ahmed for you. Again, from also the management of the leadership of Africa CDC and the African Union. One, the Republic of China really is a great partner, has been also great partners during this pandemic. We really appreciate the support from the Republic of China. Then the second, the current product under discussion from the CoronaVac has been endorsed by the African Union regulators. I think it's quite important to reemphasize that. So now let me break down a little bit on our continental strategy. On our continental strategy, we have 3 pillars. And one of the first is actually around clinical trials, ensuring that we undertake clinical trials on the continent. It's very important as part of vaccine acceptance. I think we've seen that the leadership of Sinovac has taken good steps to be able to address that. Having clinical trials on the continent, working closely with partners as part of that is really good. And the acute phase of the pandemic, we've received enough vaccine doses. At the acute phase of the pandemic, we received enough vaccine doses from Sinovac, which was very important because we didn't have vaccines. And those are the vaccines that we really, I think that's what we recognize the partnership and the support, I think, from China. So on the second bit is around vaccine acquisition and vaccine manufacturing. You're doing quite well there through bilateral deals, and as well as we're going to be for sure reaching out to meet our target of vaccinating about 70% of our population. So we need more vaccines. So on the manufacturing, very good progress. Dr. Ebawali on this call, we visited the facility Vaxera. We're quite impressed. That's our flagship center for vaccine manufacture on the continent. And in the next coming weeks, we're going to invite other member states for really learn from Vaxera, and then indirectly learn from what you've been able to achieve in that partnership with Egypt. I think it's quite commendable. So I think having said that, really, we really appreciate the support from the Republic of China, from the African Union and the Africa CDC, and we stand behind you for all the support. And also for member states, I've heard already Uganda expressing that interest. There'll be several other countries that will reach out to you. I think we stand to support those member states to increase our production capacity. By 2040, we plan to produce 60% of those vaccines on the continent. I think Sinovac has already made a good move with Algeria, with Egypt. I think more will come for sure. I think that we can meet that target by 2040. So thank you so much for inviting us. Again, apologies from Dr. Ahmed. I'm just stepping in for him so as to voice what Africa CDC, African Union perspective and support to Sinovac. Over to you, Mr. Chair.
Thank you, Dr. Dembi, and for your kind work. And indeed, Sinovac willing to collaborate with all the stakeholders in Africa and to achieve the 2040 target. Next, I would like to welcome. I would like to invite my colleague, Ms. Helen Yang, and to give another ending speech. Helen is the general manager of SinovacBiotech Hong Kong. So let's welcome Helen.
Thank you. Good afternoon. Actually, we have been spent 3 hours, but I think time is. I would like to express my gratitude to all the speakers today. Your speeches and sharings are very inspiring and very thoughtful. Also, it is our honor to have Dr. Hussainil, Minister of Science, Technology, and Innovation of Uganda, with us today. And also thanks to Dr. Hamed, and Minister of Pharmaceutical Industry of Algeria, and His Excellency Dr. Albert, Egyptian Ambassador to China, to participate in this event. And like what we said on the invitation of this event, we're facing the pandemic, and all countries in the world are in a community with a shared future. Solidarity and collaboration are the most powerful weapon to overcome the COVID-19 vaccine pandemic. And this is what Sinovac is trying to do, to participate, to contribute. And also this is the reason why we're trying to organize this event, to provide a platform for our partners, scientists, government to exchange their thoughts and ideas. I heard that many of the speakers share about their experience of using coronavirus in their country, like in Egypt, that they observed. And the data actually echo what we have been receiving from our clinical studies, as well as a few hundred million vaccines being used among the population around the world. And inactivated vaccine, the CoronaVac, is one of the products, is the best safe. And please be sure that the reason why we are using vaccine is trying to establish immunity herd. And for that, we have to reach a certain amount of vaccine coverage rate. That's why the safety is the most important factor when we are developing vaccine. And also we heard from our friends and scientists in South Africa that our conducting about the pediatric population studies for phase 3 efficacy. And this is in addition to our vaccines being approved to be used under as well. Now in South Africa, we are conducting the study in their children aged 6 months old, because we are confident that this vaccine is safe. One, having left apart in fully as also contributing to a sufficient vaccination coverage rate in order to fight against the pandemic. And many of our friends from Egypt, from Algeria, South Africa expressed their willingness of doing co-production. We have made some progress. Very much thanks to in Vaxera, Dr. Habawali, in Syria, in Sadel, that work in a very, under this pandemic, it is not easy. With the efforts, we have already made the breakthrough. I believe this is the beginning in fact localization for African partners to produce the vaccine, and we also expect to expand it. I'm talking about the production capacity that reported by each partner. I remember that 100 from Sadell 100 million Bacthera for now, but it can go up to 300 million in 2022. And also Lumulus is planning to have another 3 million. And if we have all these materialized, I think in total it will go up to 600 million doses could be produced locally in Africa. That half of the population are moving into the booster is 1 dose. But if it's 2 doses, I think we can cover 1/4 of about the population. So I believe that Sinovac is already in a position to committed to working with our partners to materialize all these aspects. And now I'm very proud to say that CoronaVac has been approved in almost 6 countries around the world, and over 2.6 billion doses have been delivered around the world. But now the not ended yet. We are still facing the new challenges coming from this new variant. And I would like to take this opportunity to report the development from Sinovac on these new generation of vaccines, which are specific to Omicron strains. And now we have already initiated development of the new vaccines based on the Omicron strain. And currently our scientists are working around the clock to make the things moving as fast as we can. Currently, our expectation is to have by the end of January, we would expect ready to make the submission of clinical study in various countries. More importantly, is that we aim to conducting the trials in Africa with our partners that we have been doing at the moment. But I hope that with this effort put together, Africa will have good accessibility about the vaccines. And our sole game, together with our partners and governments and scientists, trying to complete the pandemic fight and then go back to normal. And in the past 20 years of Sinovac, we have been engaged of developing and supplying vaccine products. CoronaVac is one of the products we're supplying. And while we're working with products we are currently supplying, including vaccines, hepatitis vaccines, polio vaccines are all the products that we will be able to country. So our aim is that together with our partners, we also are trying to contribute to what the African Union's mission, which is trying to have the 60% of the vaccines to be self-sufficient or locally produced in Africa by Africa. And hopefully Sinovac could be part of this great idea. And once again, I would like to thank everyone contributing to this announcement. And I believe this is only a beginning of our collaboration. And I'm looking forward to working with all of you. And hope that after this pandemic, we can invite all of you coming to China to show your final meet face. Thank you very much. Back to you, Wendy.
Thank you, Helen. It's really encouraged us when we see we could supply by collaboration with the partner in Africa and to increase the up to 600 million doses CoronaVac produced locally to Africa population. And also, we also are very glad to supply more vaccines, including others such as influenza, hepatitis A vaccine to the population in Africa. And the most important, we have a good news regarding Omicron, and through the contribution and effort from our scientists and the technical team, the studies on Omicron strain vaccine went so smoothly. And by February, maybe we will have some clinical studies. Maybe by end of February and March, we will have a commercial Omicron strain vaccine available. I think this is a great news and good news for everybody, including the population in Africa. So up to now, we finished all the section today, and this symposium and we're going to be end. So these dear distinguished speakers, ladies and gentlemen, I would like to express my gratitude for your participation in today's symposium. We hope today's discussion will strengthen our effort and collaborations in handling COVID-19. And thank you all, and hope stay healthy, and have a good day. Thank you. Bye-bye.
Thank you. Bye-bye.